to begin in just a few minutes, so if you can find your seat. Thank you. Good morning. I would like to welcome everyone to today's workshop. We have an excellent panel today to discuss public water system risk indicators and their impact on water system sustainability. And then we're going to have an hour at the end after our two sessions of panels to discuss sort of an open discussion, and I'm hoping it's informal and we're all able to sort of brainstorm together on sort of the methodology of developing indicators for our needs assessment. So Darren Polhemus, who's behind me here, the State Water Board's Deputy Director of the Division of Drinking Water, will provide our formal introduction, but before we do that, there are a few housekeeping things that I want to go over. If you go out these back doors and turn to the left, there are the bathrooms and drinking water fountain. And then also, just as a security issue, please look around yourself now and identify the two exits closest to you. In some cases, the exit may be behind you. In the event of a fire alarm, we are required to evacuate this room immediately. Please take your valuables with you and do not use the elevators. While staff will endeavor to assist you to the nearest exit, you should know that it may find an exit door by following the ceiling-mounted signs. Evacuees will exit down the staircase that you came up from and possibly relocate across the street. If you cannot use the stairs, you will be directed to a protective vestibule in the stairwell. Should we have to relocate out of this building, please obey all traffic signals and exercise caution crossing the street. Also, if I know we've got a lot of important people in here today, so if you wouldn't mind setting your cell phones to vibrate, that would be excellent. This workshop is being shared on a webcast, and we are recording this workshop. And so you'll see up there, if you have comments and you're one of our remote viewers, you can send them to auditorium@calepa.ca.gov. After the workshop, you can send emails to me, Michelle Frederick, at waterboards.ca.gov. And then our slides will be available after the event at the website shown above. So. And in interest of keeping on schedule, because we do have a lot of wonderful panel members we want to hear from today, we're going to take one or two questions after each panel member, and then we will pass out comment cards as an opportunity for you all to write your comments down. And if you could also write which panel member it was directed to, that would be great, and we'll collect those and bring them up at the end of the meeting. Or in the open discussion section. So without further ado, here is Darren Polhemus.
Thank you, Michelle. Glad to see the great turnout here, if I don't tear the podium apart. This is really exciting for me. I started in drinking water as a deputy director a little over 2 years ago. And so I got a quick introduction to it. I knew it a little bit from some of my work before, but I still think that the value of that is I still have those, oh my God, you gotta be kidding moments. As I learn about drinking water, the infrastructure around it, the regulatory process and whatnot. And I'll get into my slides here in a minute, but this needs analysis I think is both groundbreaking and super exciting, and we hope to learn a lot from it, and it should end up being more than just a needs analysis with a report at the end. It really want to turn this into discussion points that can further the ability to meet the human right to water in California in many different ways. So keep that in mind as you're providing the valuable input you're going to give us and the comments going forward. That's really key. And I should also thank our friends that got us the funding for this. They know who they are. We really appreciate the ability to do this, and that'll hopefully advance this cause dramatically. So quickly, so we can get to the people that know more than me and are going to help us out. This is what brings us together. This was fundamental, changing the state and how we approach it. The human right to water really is a great cause. It was mentioned by the governor yesterday, as well. I know our new secretary carries it as a passion, and we're really excited that the new administration is really continuing to pick up and move right along on this. So not missing a beat and continuing to fight for everybody having access and being able to have access to good water in California. This is one of my favorite slides. Michelle puts it in for me because it really was one of those, oh my God, you got to be kidding me moments. I come from the clean water side where we, had a good grasp of how many wastewater treatment plants there were. This slide shows about 900 of them. As kind of a comparison, I picked up on something the other day. There's like 407, I think, approximately, cities that are chartered or under general law cities that are incorporated cities. So we got double the wastewater treatments as we have incorporated cities, and obviously we know there's a lot of communities, even here in Sacramento, that are not fully incorporated. But really 7,400 water systems. I mean, it's just a dramatic indication of how fractured the utility delivery of water is in both California and nationally. Because when I was at ASDWA late last year, Pennsylvania chimes in, they've got 8,000. So, I mean, it's not necessarily a California problem, it's a national problem. I've been to several conferences now with USCPA where we're talking about the same thing. How can we address this in a holistic way? Obviously, there's no one simple solution, but there are a lot of people looking at how to address this because it creates an issue. It creates problems when we're this fractured in utility delivery. It loses its efficiency, and I don't think anybody can really argue that point. So this is the funding came from Senate Bill 862 for this. It's $3 million. We have 2 years to get it out. We hope to actually do it much quicker than that. The anticipation of my timing on this is that, we hopefully will have answers around 2 years from now. That's really pushing it even at that. But we do need to move as fast as we can. There's possibilities that we can have some parts come out earlier or later. That could be where people can provide us comments. And some of this is easier and harder. And obviously, we're going to talk about one component of that today. When we look at the focus, we really are going to cover kind of the entire water sector, both public water systems, state small water systems, and individual wells. Now, obviously, we're not talking about figuring out a way to regulate individual wells. That's crazy, but they are part of the water landscape in California. Those citizens need human right to water just like everybody. Some of the things we may figure out about wells will relate to the surrounding water systems and have impacts there. And so we need to have them in the equation. And so we're including those three structures definitely in the contemplation. Now, when you look at water system violations, I think this is an updated map, and you can go to our Human Right to Water webpage to get the very similar thing where we have our display map that shows the water systems that are in violations. They're really all around the state. There are some concentrating zones, but to me, the biggest driver always when you look at this, and it's in our annual compliance report that we do, evaluation we do every year, 90% of the violations occur in water systems that are less than 500 connections. That's a compelling statistic that we need to get to the bottom of and look at how do we address that and how do we as a state deal with that. And hopefully we have some good discussions about that today. These are some pictures Michelle has collected, and she's so graciously letting me borrow, of water systems that are struggling, obviously, and failing to maintain. The one on the right was kind of neat because it's a water tank that's leaking out the bottom, so they dug a ditch to drain away, right? That's not a really good solution to that type of water system problem. And the other one is a filter with sludge buildup that's so bad that, it's become concreted in the bottom. More problems associated with small systems. When we're looking to risk, we see both the maintenance side of it, the source side of it, the financial side of it, and I think that's hopefully these prompts things to expand your thinking today and from our panel and press them on ways that we can get at how do we identify systems at risk. There's a lot of factors that can go into that, but it needs to be both comprehensive and quick and easy and, maybe at multi-levels. So it's going to be difficult to get at that. There's no doubt about it. And it won't be perfect. But I think we can make some pretty broad cuts already of, how we hone in on these situations and keep this from happening. So to seed the group, we came up with 6. Actually, it was 5 originally because I think we told everybody they had to have their top 5, but we're throwing in 6. Top risk indicators that at least if you were to ask me in the hallway, this is what we would have rattled off. From that enforcement number and the compliance number, the low number of connections just seems to be there glaring in the face of what's going on. Second, water rates, including O&M and limited emergency reserves. I get calls all the time, pumps failed, we have no money, systems out of water. How did they get to that point? They didn't even have $1 in the bank. I mean, a pump is always going to fail, but how do we deal with that aspect of it, and are they prepared at some level? Single sources. The drought showed how susceptible a lot of water systems are to their single source, both surface water and groundwater being a problem. Significant infrastructure failure already occurring. Those pictures you just saw, I mean, it's kind of obvious. Those are hard to pick up in a database from Sacramento, but are there ways that we can analyze that in a way that is meaningful? I think also risk indicators these days are driven by zones of risk. Fire has shown to be a huge risk for a lot of small systems. How do they come back after such calamities that our communities are facing with fires? Earthquake and flooding are the same type of scenarios. If they're in those zones where they have those higher risks, are they then preparing for those in a way that would be able to recover? And in many instances, the lack of water rights or legal status or insurance, just kind of the fundamental things that we often anticipate systems would have or private businesses would have in those situations, and how does that compare to the water system? So we'll see from our panels today what they may suggest, and hopefully we want suggestions from you as well, and can move forward with trying to both identify ones that we can agree on and ones that we can then easily assess and move forward from that standpoint. Also, we have other workshops planned. So next Friday, we have the domestic well workshop where we're going to bring in different groups that have done a bunch of work in trying to assess where domestic wells are and what potential impacts are they facing. So it should be another good all-day workshop. And then we do tentatively have planned in May a cost estimation workshop that'll kind of follow on this one. It'll focus a little bit more on costs associated with once we've identified systems and what their plight might be, how do we then identify the costs needed to handle that and correct that. So that's what's coming up, and we expect a great day today. So I'm really excited. Again, I'm glad we had such a good turnout, and hopefully it turns into a great day. And Michelle will MC for us today. Thank you, Michelle, for steering this on. I will be a participant as needed and in and out as someone jerks my chain. So thank you.
Thank you, Darren. Our first speaker today is Karen Nashimoto, who is a registered civil engineer who received her bachelor's and master's degree in civil and environmental engineering from Cal Poly. She has since graduating, she has worked with the Division of Drinking Water since 2010, and she is also part of our Financial Capacity Committee, and will be sharing some of the internal work of that committee. Thank you, Karen. And I don't know, some of our panelists are going to speak from their seats, and some are going to come to the mics.
Thank you, Michelle. So in the past year, we've been working on a financial capacity committee, which included various personnel from both the Division of Drinking Water and the Division of Financial Assistance. And part of this evaluation was to really see what kind of key indicators would indicate an issue with water systems so that we could provide better financial assistance to them, and what would be an indicator of potential problems with our water systems. And so we're not just looking for water systems that we know already have problems, but also to identify systems that we may not already know have issues so that we can start working with them and get them in a better situation already. So why evaluate financial capacity? We really want to find financial capacity issues before failure. So these are some examples of grand jury findings just in 2018. There was a water system that was established in 1984, and it never had its revenues or water rates increased. So its revenues were not sufficient to meet their governance and operating expenses. We also had another grand jury findings also in 2018, where the Kern County auditor found that they really should be finding a detailed audit due to questionable accounting practices within the water system. So this really underlies that it's multifaceted issues within a water system. It's not just rate settings, it's the entire financial picture that we really should be looking at for water systems. So why is the financial capacity important? If we look at the Drinking Water Infrastructure Needs Survey from the March 2018 report, we see that California has a drinking water infrastructure backlog of about $51 billion. So this is really important that we have the appropriate funding and financial mechanisms in place for our water systems so that they can really address their infrastructure needs. So not only for their backlog, which is quite substantial, but also to move forward into the future so that they are a sustainable water system. We also began looking at other states' requirements. For example, the Ohio Environmental Protection Agency passed Senate Bill 2, which required public water systems in Ohio to demonstrate technical, managerial, and financial capability of their systems by implementing an asset management program by October 1st of 2018. So we're really not the only state that are starting to look more into financial capacity and really delve into this a little bit deeper. Washington is another state that's also delving more into financial requirements for their water system. They require a water system plan for new systems that serve 1,000 or more service connections, or are planning to expand or seek funding. They also require a small water system management program for all other public water systems. So they kind of touch all water systems for their financial requirements. And something that's a little bit different than what we require is they have a regional planners that lead the review effort for all of these plans. So instead of being spread out through all the offices that we currently do with our field offices, they have somebody that's specialized, that's really looking at these plans, that has a little bit more knowledge into these particular aspects. Washington focuses on 5 steps with their financial evaluation. First, they are developing an operational budget for their water systems. And then they look at water systems creating an operating cash reserve, creating and funding an emergency reserve, creating and funding reserves for capital improvements and equipment replacement. And also they ensure that their water systems are periodically reviewing rates, which is really important to make sure that the water systems are having sufficient funds to finance their water system. So we came back to what our goals were for our financial committee. And so we want for us as the regulators to kind of shift the mindset towards addressing more of the underlying financial issues and the longer-term financial planning and sustainability of our water systems for the long term. We also want to look towards shifting water system mindset from just looking at the operation and maintenance and start including critical planning, capital planning in water rates and upgrading their infrastructure. So they're not just looking at the here and now, but also into the future. So with our pilot study, we began assessing water systems for financial capacity during their sanitary surveys, and we created a pilot questionnaire so that we could see what kind of responses the water systems would have on the effectiveness of the questions that we created, what kind of concerns they would have by rolling this out, and just how they'd respond to the vocabulary we were asking or using, and really anything else that would come up. And then we also included that we may develop further regulatory authority in the future because the California Health and Safety Code already allows creation of further regulations, although we have not gone too much further into that at this point. So this is a draft of our sanitary survey checklist and guidance. As you can see, it is pretty long. It's 29 questions. We kind of threw everything in the kitchen sink at this. This was really just a first run at it to really see what would be appropriate questions to ask in our pilot study and how our outreach to our water systems and the initial capacity evaluation would work. So we had kind of had 5 different financial capacity indicators that we were looking at to look at water systems financial sustainability. So the first subject was asset management, to see if water systems were tracking their assets, their age of assets, if they had an inventory, and really see what kind of planning they had for it. The second kind of subject was short and long-term strategic plans, to see what they were doing in the here and now, but also how they were planning for the future, and if they had any plans for the future for long-term improvements. We also were looking at their reserve and debt management. So we really wanted to make sure our water systems had appropriate funding in place so that if there was a single emergency, it wouldn't wipe them out. Like if there was a pump failure, that they had sufficient reserves in place that they could keep going, that they had that money in reserve to repair their system and keep it in operation. The fourth aspect that we were considering was financial planning, looking that they had appropriate rate structures for their water system, that their revenues and expenses were appropriate. And then finally, we're looking at fiscal accountability, that they had checks and balances and appropriate record keeping. So for our pilot study, we selected 10 water systems throughout the breadth of California, all different water system types, different sizes. Some were in compliance, some weren't, to really kind of get a good cross-section of different kinds of water systems to get a good response to our assessment and get feedback to what we were planning on doing. So as a result of this pilot study, we had a lot of terminology challenges. The different types of water systems understood vocabulary differently. We had time challenges due to the length of evaluation, which we kind of expected. And then we found that small and disadvantaged water systems really appeared to be in more need of assistance, and that it really would be appropriate to have additional training and follow-up assistance as needed, so that when we went out and talked to these water systems, and if we found financial capacity issues, that we already had the resources lined up to provide assistance, so that we wouldn't be out there finding a problem and working with the water system and then not have a tangible outcome, not have resources available for them to solve their problem. So our next steps are to refine the financial evaluations for some of the terminology challenges that we really found, and for the system type. It seemed like it would be more appropriate to split the evaluations up so that they could have terminology that are more appropriate for the particular water system type and size, so that it is more readily understandable for our target audiences. We also wanted to perform additional stakeholder outreach so that we could get more feedback, and we want to expand the training and assistance resource and availability so that when we do these evaluations, that there are already our resources in place, so that in the event there is a problem, that we really can have resources available to assess these water systems, that if they do have any concerns or issues with their finances. One of the big things that we really did identify as a need was to tie this financial value effort to defined expectations for water systems. We don't want to go out there and just collect information. We want to have a tangible need of what are we doing, why are we collecting this information, and not just collect information for information's sake, and really demonstrate a benefit of the financial evaluation to a water system. So if a water system needs rate evaluations or help with rate setting, or they need help with a capital improvement plan, to really show the water system what they're getting out of this, that this can improve their water system. It's not just for our benefit, but it also has a tangible benefit for the water system of going through this evaluation. So the intention is to incorporate these evaluations of their finances into sanitary surveys statewide, but the rollout of the financial evaluations will be prioritized on a basis of need. So, thank you for your time.
Thank you, Karen. Sorry about the lights here. I know that was hard to see a little bit. Sorry to. So why don't we take one or two quick questions if we have them while we still have Darren before he may run off. If there are any, otherwise we will move on to the next presentation. We have one in the front there, Caitlin.
Best way to get to you.
Jennifer Clary, Clean Water Action. I'm just wondering if there's any kind of written report available for public review of your pilot study?
Not at this time.
Hello, my name is Mary Wood, and I am a member of a small association. And my biggest problem is that if you want water, you have to play by the rules of the association. And I don't get safe or affordable water. So if you are investigating the financials of just the association, you're not talking to all the members. So I wondered if there is any process for complaints, that you'll actually listen to people who aren't getting safe and affordable water.
So we are always open to hearing complaints from any member of the community. So if you have complaints, please do contact us.
I might add to that, in each of our districts, there's a district engineer, and you can find a map on our website. And so it will give you the district engineer's name and a telephone number for them. So if you have concerns and you're at a community level, or a community member, you can always contact the district engineer. Okay. Great. So moving on to our next two speakers. Our next two speakers are Karen McBride and Katrina Hyatt, and they are both with RCAC, which is the Rural Community Assistance Corporation, and they are both, Karen McBride is a rural development environmental specialist and has been at a lot of the community members and community outreach meetings that I've been to over the years. She has 21 years with RCAC, and she has a very long, illustrious career, but so I'm just going to point out a couple of interesting facts about Karen. So she is a California State Certified Wastewater Operator and a former commissioner of the City of Sacramento Utility Rates Commission. And Katrina joined RCAC in 2018. So welcome, Katrina. Prior to joining RCAC, Ms. Hyatt worked as the environmental health specialist in water protection at Yolo County and Sacramento counties, where she assisted the public in complying with well ordinance and state water codes. So turn it over to you, ladies. Thank you.
Today we're going to talk about the IRWIM needs assessments that we've been doing over this last year.
I have worked on the ones for the Sac River region, and then Karen's going to share a little bit about the ones that she's done on the Central Coast, things that we've learned. Okay, good, it works. The survey methods that we used, we were provided a list of designated census areas that they wanted us to focus on. These were all disadvantaged communities, either just disadvantaged or severely disadvantaged, so you can take that into consideration with our outcomes. We researched the water systems that were in these areas. It was a little bit of a search, and we're still kind of finding more and more water systems. There's so many out there of small systems. We outreached to the communities, so if there was a predominant water system or two or three, we would outreach to the operator typically, or the manager, depending on how it was structured. We would do in-person meetings, so we would schedule a time, about 2 hours, to go out and meet with the designated person and talk to them, try to make it informal, not just answering the survey questions, but to get them kind of talking about their water system so we could get a little bit more of those nuanced things about the condition. We would also do a system tour, so that was part of it. These, hopefully you can see those up there. The TMF elements that we used were pretty standard, but like I said, we wanted to get sort of more of the nuanced things that weren't necessarily going to be documented, in their compliance status. So some of these things, they may look like they're in compliance on paper, but when you kind of dig into it, they have an operator who's been there for a long time and kind of just has everything up in their head, but they may not have things written. So a little bit of an issue with succession in a lot of these. Our top 5 indicators of hardship that we came up with were deferred maintenance, no certified operator, or an operator that is on the books, but maybe not available as often as the system needs them to be. A lack of documented plans and policies. Just the fact that they're treating surface water, because it's so expensive for a small system. They need a higher grade operator. There's a lot that comes with it. And then also if they were unmetered and had a flat rate. So here's a few photos of a system that I visited this spring that kind of outlined some of the technical challenges that we encounter. They have a lot of deferred maintenance, so you can see that the pipes here are kind of held together with some cords and things, and there's actually a piece of fabric at the bottom there that's covering a leak. So it's not really fixing anything, it's just keeping it from shooting straight into the air. And then the other photo is a large leak in one of their main lines that the person who is managing the water system, he's just a park resident. It's a mobile home park. And he's unpaid, volunteer. He typically fixes things out of his pocket and then gets reimbursed by the owner. So some of these large things he's not able to fix. And they do have a certified operator that's contracted, but that operator typically just visits the water system once a month to do the bacteriological samples. So you can see they had several things that they needed to be repaired that they're just living with now because the owner is not on site and is typically not really available to the water system. And it's just an elderly gentleman that's maintaining the water system on a volunteer basis. Some of the managerial challenges, lack of plans and policies. So a lot of times we would go in and they would say, oh yeah, we have policies for this and that, and we have, operations and maintenance procedures. And we say, okay, well, can we see your document? Like, what would you give to somebody if you were unavailable and somebody needed to come and take care of the system? And they say, oh, well, we just have it kind of, in our heads, and it's a lot of institutional knowledge. So we tried to impress on them that the importance for written documents that can be passed on. And then also customer policies. If it's not written down, they just say, oh yeah, well, we have a drought policy. try to keep people from watering their lawns too much. But that doesn't really give a clear definition to people what they need to be doing. For surface water challenges, you can see it's not exact, but this is the same reservoir, and it's feeding a small water system up in Northern California. I visited them in May, and then I actually went back for a camping trip in October, and I was shocked at how low the reservoir was. And it just shows you that they have very little control over their source, because there's a dam, and they're not the ones deciding how much water is going to go in and out. And it does affect the quality, obviously, when you get down that low. As far as financial challenges, things that we look for as kind of a red flag would be year-to-year budget, so they're not planning for the future. If they're unmetered and have a flat rate, they probably never had a rate study, and if they have, it may not have been that useful, because when there's no meters, you can't tell the water usage, and people, they like to see things laid out so that it looks fair. And if you don't have that usage tracked, then people, will say, oh, well, it's because this guy over here keeps watering his lawn. It's not me, it's them. So that really ends up causing a problem with being able to track finances.
Thanks, Katrina. So just some closing thoughts on more of the community dynamics. We've been, as Katrina mentioned, doing work in the Central Coast on conducting needs assessments using DWR's needs assessments, which we'll share with you as well. But I think we're all in agreement on some of the closing thoughts on what we're finding with conducting the needs assessments. One, of course, community willingness. We work with a lot of communities that don't really want change. I think we all can agree to that if we are trying to find a goal to get safe, affordable water, a lot of times community do resist change. A lot of times they don't have any desire to adjust rates. Recently conducted a needs assessment to a community that actually received funding for wastewater improvement. Their needs assessment was looking pretty good when I was doing the interview, but as we really kind of peeled back the layers and got into the weeds of kind of talking about the dynamics of the community, I asked them when's the last time they adjusted rates, and they mentioned 10 years. And even under construction, they had no desire to adjust them in the future. So again, I think if we were to develop a set of additional questions, we could really enhance more of the community element of it. I think it's very important. Also, our community boards a lot of our boards are not willing to make a change either, whether it's political or just a board member that's been on the board for a number of years. So oftentimes it's hard to move a community forward with a board member or two that doesn't want to make the change either. And then also the community willingness is getting safe drinking water to, a lot of times our communities are split in half. Some communities we have are still on bottled water or hauled, and maybe the funding is going to cover part of the community. Again, another obstacle to consider and looking at, both for the community wanting to make the change, but also kind of those funding phases that we oftentimes work with. Succession planning is a big one, not only for our operators, but again, our board members. A lot of our communities don't have anything in place to succession plan. And as we have aging operators that want to retire, often that's not really something that they can do easily. Or maybe they have a board member running the system that wants to retire or doesn't want that responsibility. So stronger succession planning checkpoints are definitely also another consideration. A lot of our smaller rural communities, and these are disadvantaged, of course, and severely disadvantaged, Office staff are also, a lot of the bookkeepers, office staff, the bill collecting, delinquency accounts, again, are older, maybe older staff that, again, get kind of worn out along the way. Other impacts to safe drinking water, as Michelle mentioned, I am a wastewater operator. I really do put emphasis on the wastewater side. I think oftentimes we forget the other side of the fence. In order to get safe drinking water to our communities, we really need to look into what's going on with the wastewater. And of course, a lot of our rural, small communities are served by decentralized septic, not centralized sewer. So sometimes failing septic, of course, if that's what's going on with the community, can greatly impact getting them safe drinking water. So more emphasis, I think, on wastewater impacts as well as stormwater impacts to clean water. Better checkpoints along the way. If our, again, ultimate goal is to really plan for long-term planning, I think we could do a better job at checking and rechecking and making adjustments along the way. I think oftentimes we get a community position to get them funding, or maybe we get them a contract operator, whatever it takes to keep the system moving, but we're not returning in a timely manner. If, again, it's a long-term planning and an ultimate long-term goal, we need to do a better job at revisiting some of those needs assessments area that may be scored low or might have been a potential red flag. So I think better checkpoints along the way in really making sure that we're achieving longevity with both improving water and, of course, again, the succession planning or whatever they may have again, kind of scored low. And then a uniform understanding of what we're asking. We were kind of talking about this earlier. We know that if we had 5 individuals conduct needs assessments to the same community, we would come up with 5 different results. So if, again, we are wanting to move forward with compiling some kind of a uniform understanding, we really need to make sure that we have that uniform understanding of what we're asking. And I did attach this is DWR's kind of entry needs assessment. Again, we use with a lot of our communities. If we feel that we really need to do a deeper dive with some of the communities, we'll go ahead and perform this one, but we like to then perform more of a TMF, a technical, managerial, financial analysis to do a little bit deeper analysis. But this just gives you kind of a snapshot of some of the questions on here. I apologize that it's kind of hard to read. But I guess a good example is this, 4th column asking, is it accessible for the community? And of course, is it affordable for the community? Again, oftentimes when we do needs assessments, we like to not only interview the system operator, but we like to also interview the board, the regulatory folks, all the people that are involved with that community, because of course we can extract all kinds of information if we do more of a holistic needs assessment in order to get that. So accessible for the community, again, not having that uniform understanding of what we're asking. I could take this of, yeah, it's accessible, it's right here, and I can turn on the faucet. Or are we asking, is it accessible for all community as a whole? And affordable for the community, of course, that's a loaded question. We've all had experience in that when we work with our communities, it's not often affordable in their eyes, but maybe when that question is posed to more of a regulatory body, it might be in their eyes. So again, I think we could do a little bit better on kind of, again, having that understanding of what we're asking. And I think that's pretty much it. Thank you.
Thank you, Katrina. Thank you, Karen. Do we have any questions for our 2 panelists? I see one in the back.
Hi, I'm Vanessa Soto with Self-Help Enterprises. I just wanted to comment a little bit about the overall thoughts on community willingness, and that we usually find that disadvantaged communities resist change that might be needed. And I think it's important to consider the underlying reasons why they might resist change, and a lot of times it's what the previous presentation kind of showed, in that they don't have financial capacity to implement these changes, or they're just worried that they're not going to be able to maintain these changes, or they don't have enough TMF support in general or knowledge to do that. So I think it's really important to keep that in mind, rather than just thinking that, they're just resistant to change. But there are some real underlying factors that really impact disadvantaged communities that make that so. And then kind of another comment is Self-Help, along with EJCW and Provost and Pritchard, which is an engineering company. We also participated in the IRWM needs assessment efforts. And so the DWR table was a suggestion on how a needs assessment could kind of show its data. But the DWR, like the guidelines, they weren't really prescriptive. And so I just would like to point out that the needs assessments were done based on funding area, and each funding area could develop their own scope and their own set of questions that they wanted to focus on. But I mention that because I think that there's a real opportunity to kind of cross-reference data, put all of our data together, see what we have, and then see what's needed in this statewide effort through the SWRCB. Thanks.
Thank you for that comment. And that really is kind of the point of what we're trying to do today, is bring together all the different areas and all the different people that are working in this space in order to make sure that we're not creating redundancies and that we're capturing all of those important points. So thank you for that. Are there any other questions or comments? Okay, so we will move on. Oops, that's too high there. We'll move on to our next speaker, who is Dr. Holly Alpert, who lives in Bishop, California, and works as the IRWMP coordinator for California Rural Water Association, and is the director of the Inyo Mono IRWM program in Eastern California. She has been working with small, rural, and disadvantaged communities for the past 11 years with the goal of building capacity. Thank you, Holly.
Good morning, everybody. Make sure you know how this works. Okay. So everything that's been talked about already is really helpful. It's setting this all up really well. I'm going to confirm a lot of what's been already said, and I think we're already starting to see some themes, especially around some of these indicators. So as Michelle indicated, I kind of have two hats. I'm here officially in the capacity of the California Rural Water Association Integrated Regional Water Management Plan Coordinator. I'll talk about that a bit. And then I've also been working with the Inyo Mono IRWM program in Eastern California, Bishop, Mammoth, Ridgecrest area for about 11 years. So similar to RCAC, I'm really here to provide the rural, DAC, headwaters, desert perspective. So I'll talk a little bit about some of the needs assessment work that we do as California Rural Water Association, and then I'll dive down into what we've done in the Inyo Mono region, and then towards the end do some of my indicators of sustainability and a couple of recommendations. The mission of the California Rural Water Association is to provide training, technical assistance, resources, and information to assist water and wastewater utilities in achieving high standards of service. A very first step in doing this is to assess needs. We need to figure out what's going on in these communities and these systems before we can think about how to bring assistance to them. So we do this at Rural Water through a few different programs. We work through the State Revolving Fund program, working with the list of systems that's on the assistance referral list. We are working, as I know RCAC and Self-Help are, in the Proposition 1 Technical Assistance program through the State Board. We also work through the Integrated Regional Water Management Program, which I'll talk about more, and we also have a tribal program. So all of these programs include needs assessments. One of the IRWM programs we're working through is the Mojave IRWMP, down south, headquartered near Victorville, Apple Valley. We partner with Mojave Water Agency, that should be agency singular, not plural, but through Mojave Water Agency, we're working with about 40 small disadvantaged systems in their IRWMP region. And it's a unique model that Rural Water came up with in partnership with Mojave in the last few years, where we offer a menu of services. And the first on that menu is a needs assessment, and then you can sort of see what other kinds of services we might provide in addition to and following a needs assessment. But the story here is really that the needs assessment comes first before we can decide what else that we need to do. Like I said, it's a unique model, and so the Association of California Water Agencies recognized it in 2016 with an award for excellence. And I put the website there. If it's not visible, it's www.smallwatersystems.org. And we're thinking about how we can use this model in other parts of California. And indeed, we're starting to use it in a few different parts, but especially the Inyo-Mono region, and I'll talk about that. So similar to RCAC and self-help, we've been involved with different aspects, not just needs assessments, for the DWR IRWM program. We've been doing this through Proposition 84, and now we continue to do it through Proposition 1. The current Disadvantaged Communities Involvement Program, which is the first round of Prop 1 funding, IRWM funding that we're seeing, is, as a couple people have already indicated, the goal is to think about how to involve and engage disadvantaged communities in the IRWM program on a regional level. So again, a first step, a primary objective of doing that is to actually get into the communities and assess need to see what's going on out there currently. And self-help said it really well. We're looking to scale that up. The state is looking to be able to compile all of this information that we're collecting throughout the state and get an idea of what's going on in DACs right now. And I will say that it's a snapshot, and it's one snapshot in time, and I'll talk a little bit about that. But I think we're all developing some really good information right now. And again, this is an initial step in a larger process of then getting into providing assistance, financial resources, and this is just the first part of that conversation. So Rural Water is through the DACI program, Disadvantaged Communities Involvement. We're working in several areas. A primary place we're working is the Lahontan funding area where the Inyo-Mono group is. I'll talk about that. We're working in the Santa Ana Watershed Project Authority area with mutual water systems in that IRWIMP region. And we've also worked a bit in the Sacramento River funding area with RCAC. And again, this has already been said, but the work we're doing in DACI has a specific purpose. DWR, like Karen showed, has a specific set of indicators that it's looking at, that the kinds of information that they want us to collect. But I will say that information is similar to other information we're collecting through some of the other programs I talked about. And I don't think we're working crosswise to each other, but and again, this was brought up, I think it's really important to see how we can share our information and our results. And within the DACI program, that's already being done. There's an effort to get all of us, IRWM regions and service providers together to talk about not only the format of our needs assessments, but then how to share results. And I think in the end, that will help to standardize and provide some conformity to the type of information that we're providing to DWR. So that effort is out there. We're not too far into it yet, but we're all also at very different stages in doing our needs assessments. So I'll talk about the Inyo-Mono region a bit. And I'll say that I think our experience is fairly representative of IRWM in general, but I fully recognize there are a lot of regional differences. So if others in the room have worked with other regions, I think it would be really helpful to hear that. And as I thought about how we've been doing needs assessments, we've been doing it since day one. It's part of the process. It's part of building relationships and starting to talk with people. However, then we have done sort of a more official, formal, and informal needs assessments. Again, this was back, we started with Prop 84. We weren't going during Prop 50 yet. But during our Prop 84 planning grants, and we also had a disadvantaged communities grant, we conducted 32 formal needs assessments. Rural Water came out and actually met with water systems in their communities on the ground, similar to how I think they're being done everywhere now, and actually completed a formal needs assessment form. And this isn't readable, but I put the list up there as an indication of the different things that we look for. And Katrina already put the TMF elements up there. So a lot of what she showed in her list would be on this sheet. And again, sharing that information among service providers and IRWM regions, then we can try to be a little bit more uniform in how we're collecting that information. And then I'd say maybe even more than the formal needs assessments are the informal conversations that we have with people. And I'll give a couple of examples of these, but we do everything from kind of more formal public outreach meetings in a community where we obviously invite the water system, but then encourage community members to attend so that we can get information directly from ratepayers. We do a lot of one-on-one meetings with water systems, and we hear a lot about what's going on through that. So I don't think about it as assessing need as I'm going into that, but that's what takes place. And then just a daily correspondence. People call and say, this is what's going on, and do you have resources for this, or this is a concern? So it's kind of a constant process. So I'll talk about some of what we've learned in terms of specifics to do with individual water systems, and then how we're starting to scale up regionally and some more general thoughts about it. So for individual water systems and communities, and yes, they're sort of distinct entities, but I use them interchangeably a bit, we learn about specific infrastructure needs, which are also, not always, but they often lend themselves to specific project needs. And then we learn about the technical, managerial, financial elements that we've already been hearing about. We find out what's working well and what isn't working so well, and that becomes our need. So again, these are water system specific, and they're happening through kind of this formal and informal process. And a few of the systems that we work with are listed here, and they're sort of forefront in my mind because we have been working with them really recently. The Lundy Mutual Water Company is a small mutual just on the north shore of Mono Lake. We just held a community meeting with them, and that's a picture of my colleague giving a talk about what the IRWMP is. And it was fascinating. The entire board of the system was there, as was a water operator, and then probably about 20, 25 community members. And this is a community of maybe 100. So, it's not a bad turnout. We serve pie, and that really helps get people to attend. And we do them in the evening because people work during the day, so we make ourselves available when the community is available. And we heard concerns from the community members that could be expressed to us, but they were really for the board, or concerns to be directed towards the board. And I think it was helpful for the board to have that. We didn't get the sense that they have many of their own community meetings. A week later, they then invited me back to meet specifically with the board so we could get into a few more of the issues about what they're needing right now. And their challenges mainly have to do with aging infrastructure. They need an overall engineering review of the system and somebody to help them then sit and prioritize what their needs are. So I can't do that. I'm not the engineer, but through Rural Water, we can then provide those resources, get an engineer on the ground, and start looking at the system. They also have some managerial and of course, also always financial capacity issues, but we were able to get into this engineering review needs to be the first thing done. So that was more of an informal needs assessment. I didn't go through the formal list. And again, that wasn't, sorry, when we do formal needs assessments, we have somebody else from Rural Water come into the region I don't know enough about it to sit and do that, so this was a different kind of talking to the system. We've also currently working with the Big Pine Paiute tribe and the Big Pine CSD. They are in the same town. They have come to us and said, we are very interested in connecting our two systems and having an intertie, mainly for fire flow protection, but also could serve for drinking water emergencies. And so we started talking about that, but at the same time realized, well, we've done needs assessments for them in the past. It was a while ago, so probably time to do it again. So a rural water person came out, I went with her, we went to Big Pine, sat with both entities at the same time so that we could get a sense of what's happening in each of the systems. But having them both sitting there, I think actually really helped because they were able to hear what each other is thinking about and what's going on there because, again, they reside in the same community, so it's related. But we had gotten the initial idea from an intertie project from a previous community meeting that we had held. So again, things come up in different venues. And then recently we're also working with Keeler CSD. If you know the Owens Valley at all, nobody knows where Keeler is, but the Owens Lake, which is at the bottom of the Owens Valley, Keeler's on the tiny community, 45 connections on the east side of Owens Lake. And they have difficulties. And I just learned that the main board member that I work with, he's stepping down. So I know they're gonna have my managerial issues very quickly. We did just go do a formal needs assessment for them. And they have issues all over the board. The TMF infrastructure projects, it's all there. So right now we're in the process of trying to prioritize how do we prioritize the needs and then how do we start attacking those. So those are some of the communities that we work with. In doing these needs assessments, especially through Prop 84 and Prop 84, and now we'll be able to start updating this, we start seeing some regional trends. So in Inyo-Mono, we're seeing some trends related to contamination issues. We see some groundwater contamination because of naturally occurring arsenic and uranium coming from the granitic bedrock. Aging infrastructure clearly is all over the state, but we're seeing it throughout the region. And again, this is more of the TMF part. We see a lot of turnover with staffs and boards, lack of records, lacking written operator instructions, water conservation plans. We're obviously starting to see a statewide trend already, but this is some of the specifics that we're seeing. And then we can say, okay, if we're seeing folks don't have water conservation plans, and we definitely saw some impacts from this last big drought. Let's go in and either work one-on-one with systems in developing those plans, or maybe provide a group training where 20 systems can come to one training, and a rural water trainer can say, these are the elements that need to go into the plan. On the financial side, we see a lack of capital improvement plans, 5-year budgets. So some of the challenges we've come across in doing the needs assessments, again, in a rural, very large area, has to do with the travel distances, both for water systems and communities to participate in the IRWM process, but then us as the IRWM practitioners to go out to these communities and do the needs assessments, and then following up with technical assistance and trainings. Karen, you mentioned this already, skeptical community members, and walking into a public outreach meeting and having some people say, are you the state? What are you doing? I don't want to tell you what's going on with our system. They could be board members, they could be regular ratepayers. We've gotten actually quite a bit of that in rural Inyo-Mono. And everybody in these small communities wears 5 hats. So it's difficult sometimes to get a board member and a water operator sitting at the same time at a table to be able to go through a formal needs assessment. So I find that I see people at different times. I saw a water operator on Bishop in his truck the other day, and I stopped him and I said, what's going on? So sometimes we have to catch them when we can. And then these are also regional trends, but I think what I've learned in the bigger picture, and hopefully this will be helpful to the state, is that the needs change over time, which is fairly intuitive, but now that we're starting to go back out and doing some more needs assessments and some repeated needs assessments. I'm really learning it again. In terms of outreach, whether it's formal or a little bit more informal, regular and repeated outreach is absolutely essential. It's, especially over these long-term IRWM programs, I can't have gone into a community in 2009 and find out what's going on and then assume the same thing's happening in 2019. So we found that we go there regularly, and that's the next point, is the on-site visits are really important. We do ask them to come to some of our bigger meetings, and we do ask them to travel at times, but when we can, we try to get out there, and so we can see what's happening on the ground. And again, at a time that's convenient for them, whether it's evenings or weekends. And then I think my biggest lesson has been listening. And listening doesn't solve problems, but at the same time, I think it has really helped, I would say, especially for board members, to have an ear there, somebody listening to what's going on, and who can think about what resources are available. So based on my experience, this is what I came up with, and for my indicators of unsustainability, and they're related to what everybody's already given so far. So we're starting to see a bigger picture. Lack of attention to rates. It's the same story I hear. Systems haven't raised rates in 10, 20 years, and related to number two, and these are in no particular order, that affects what can happen with system maintenance, repairs, replacement, whether they don't prioritize repairs and maintenance because it's just not a priority or because they don't have money, that could change. But often I see number one leading into number two. We heard this also, it can be challenging to find the support in the community. At the same time, I think there's the onus in a lot of ways is on the water system to provide information and provide education about what it takes to run a water system. And it goes back to rates. What kind of money does it take to run a water system? And just in terms of the capacity of board members who don't necessarily know what they're doing, getting in here and learning about water management. And so I think more education from the water system to the community could be really important in helping to get rid of number three or at least shift it. Again, we heard this already. We tend to see quite a bit of turnover. I would say mostly more in board members than staff, but water operators are starting to age out of the system. They're retiring. In our area, I'm sure this happens elsewhere, we have water operators who might be the operator for 5 or 6 systems. So all of a sudden they look at retiring and you've just lost all this institutional knowledge for 5 or 6 systems. So that's been challenging. That presents a challenge to them as the system in how they manage themselves. It also presents a challenge to us as the IRWIN program in that we may develop a relationship with board members or operators, and then they turn over and we need to go develop another relationship. And it certainly is possible, and we do it, but I would say it slows down the process of assistance. And then lack of expertise, probably mostly on board member part, they develop a lot of knowledge as they get into the management of a water system, but they turn over. A lot of these guys are volunteer, they don't know much about water management, and so they'll come to us and say, okay, we know we need a new distribution system, or we know we want to replace these parts. How do we even get started? Do they need a feasibility study first? Do they need, what's the first step? And so that's where the IRWIN program and service providers like Rural Water and RCAC can come in and say, okay, we can help you get to that first step. And then a few recommendations, again, just based on my experience in the IRWM world, is as we're going out there through this new needs assessment program and finding out what's happening around the state, the IRWM practitioners have done a lot of this. And again, more can be done and repeated visits need to happen. But let's utilize what we have already done in terms of what we already know, sort of that static body of knowledge as it sits right now, And then looking forward into the future, as the state or whoever is going to be getting on the ground doing this work, let's again utilize the IRWM process and the network. We've done the work of establishing relationships. We've been working on the ground. We know what most, not all, of the communities are like. So I think I hope that we can really serve as a good resource. And then I definitely encourage the use of these, I'm calling it outside service providers, but I don't know outside of what, but these service providers who, again, have worked in these communities, and they know the communities, they know how to do the needs assessments, they know how to talk to the water systems. And then as I was thinking about this, and I didn't get it on here, my other thought was, with all of this work that we're doing in the DAC involvement program has been mentioned, we're gathering a lot of information and data. So we obviously need to be scaling that up, and DWR wants it, but let's also provide it to the state board and whoever else needs it. To me, none of this is proprietary, it's all public money, so let's provide what's out there and then build on top of that. I think that's it, thank you.
Thank you, Holly. That was excellent. I appreciate it. As I was just sitting there listening to it, the thing that kept coming to my mind is how many different types of practitioners we need. We need community outreach, and we need financial specialists, and we need our engineers, and it's just such a broad set of needs. So thank you. Okay, and so we'll take just one or two questions if we have time. Caitlin, we have one up here in the front.
So you just touched on my question. My name is Andrea Ventura. I'm with Clean Water Action. And, other than the issue that was brought up earlier by self-help enterprises, that sometimes the community doesn't have the resources to support their water system, one of the things I've heard from operators in disadvantaged communities is we don't just need technical assistance and financial assistance. We need communication assistance. We don't know, I'm one guy here who's got people in my community clogging up my phone about their rates. And how do I explain that to them? I don't know how to explain that to them, and I don't have the resources to explain that to them. Whereas if you live in a big system like I do, I get lots of material from my water district, and it's great. But, so can you speak to that issue?
Yes. What I didn't mention in here, I think a lot more board training could happen. And whether that's coming from service providers or from the state, there could be a lot more information provided to board members about how to communicate. I've also turned water systems onto various resources that are available, outside resources to help them communicate. So for example, DWR for a while had some facilitation assistance available through Prop 84. And for one of our systems who needed to raise rates, and they were having difficulty in knowing how to talk about that to their ratepayers, they brought in a facilitator that DWR provided and paid for to the Prop 218 meeting, and I think several other community meetings. And they let that outside person do it. To me, ideally, it would be nice to build the capacity in the water system that those board members or staff could be able to do that, and that takes training. And there are also other resources available for that. Does that help a little bit?
Am I allowed to comment on that?
Of course.
Okay. When we do rate studies with communities, that is the final step after we determine the rates with the water system, is we then take it to a community meeting and we show the community this is how we determine the rates. And that's what I was speaking about. It's a little bit easier when a system is metered because you can show that they are paying, a fair or equitable amount for their water based on their usage. But you can still do it with the flat rate. It's just a little bit harder to show the community that they're paying their fair share, or that their neighbor's paying their fair share. But that is part of what we work with the water systems on, is how to communicate. Why are we charging this rate? Why are we increasing the rate? these are the costs that we're planning for with the capital improvements that are going to be required. You know, just like planning for that pump that everyone's been talking about, there's a lot more to it. That's part of the rate study that we do, is we look at the costs and how long are these things going to last, how much life do they have left in them, what is it going to cost to replace it, how much do we need to save. Most of these systems, a lot of the small systems don't have reserve funds, or they have one lump reserve fund that's, you know, kind of just, oh, we're saving this money for a rainy day, but they haven't calculated how much do they actually need. So that's part of our process, is also to take that information to the community. And, you know, they have to show up to the meeting, but if they show up, then, you know, they have a voice and they get to, you know, we'll show them the numbers, we'll show them the spreadsheet, the model that we use, go through it, you know, until that they have a good understanding.
Thank you. Rena, we have one in the back there.
Hi, my name is Javier Silva, and I am representing the North Coast IRWM. I've been contracted to do the tribal portion of the technical assistance needs data gathering. And they also wanted me to tell you that we have in the North Coast a technical assistance selection process for tribal and non-tribal systems. And I think that I agree with a lot of what's been said about syncing the information that's coming out there. As a tribal operator, there are a lot of people that come to us all the time, providers, and we are constantly assessed. And I think that when I've been out there talking, there's the frustration goes, we constantly give you this information or give people this information, and it just goes somewhere, and we don't get any of the follow-up and where that's going to be at. And so what we've done in the North Coast is everybody will get on that list, and we're going to have to prioritize, because, you know, you have the most neediest and the not neediest. But I think the follow-up is the biggest thing, too, is letting them know that just because you gave us all your information, we're out there seeking funding for you, but we're not going to involve you anymore. So I think that's really important, too. Thank you.
Thank you. I think that was a great comment. Thank you. And we certainly want to include all of the different members that are working on this and take that information and put it together. And also with our districts, what they do, because a lot of them are also out there in the field. Yes, Dad.
Thank you so much. I just want to follow up on one question. My name is Bertrand. I'm with the Office of Sustainable Water Solution here in the State Water Board, and we do have contractors that work for us, in particular RCAC, and we've been doing this for over 20 years, and what we do have is the service that I think Community Water Center, somebody was asking, and that is we do have this free training. And we recognize that board training is one of those that's mostly very needed for new board members and things like that, for small communities that don't know anything about water systems. So we have those training available on RCAC website and also our website, and we do this every year that we come up with new trainings, and these board trainings are available. And they are also, we recognize a lot of board members are busy, so it's also, we have that training available on web trainings that you can do it in the evenings, hours, and things like that. So please look at RCAC and our website. We do have training available. And my name is Datran. Anyone who wants to get in touch with me, just look me up at 916-248-2719. Thank you.
Thank you, Dad. Can we put that on a comment card? Thank you.
Just real quick, he's speaking about the SRF trainings, and we had a little lag in the contract being signed. So we're getting them now up on our website just as of this week. So maybe give it another week or so before you go and check for trainings for SRF.
Okay, thank you. And yes, your trainings are very good. I've sat in on some of them. So our next speaker is Amanda Fensel, and she is a PhD candidate and researcher with the UC Davis Center for Policy and Behavior. and the UC Davis Center for Regional Change. She is also working with Community Water System to develop a drinking water vulnerability tool to support improved local, regional, and state planning. So please join me in welcoming Amanda.
Hi, everyone. I am just going to talk about my work at UC Davis. So if you have questions about that Community Water Center project that is with Sigma funding, I'm happy to talk about that after this. I'm also going to raise this a little bit. I don't have to look down. So I've been asked today to talk about some of our water justice research in disadvantaged communities, and this is partly a study focused in the San Joaquin Valley, and then we've recently expanded it into the West Side urban region. So I'm going to talk a little bit about both of those studies. And if you're interested, I also do a lot in thinking about drought. So some of these systems I've also interviewed, and we've thought through the way that small systems and large systems are preparing or not and how they're impacted. So that's another thing. As we get into Q&A, I'm happy to talk more about. So what is a disadvantaged unincorporated communities? We've talked a lot about disadvantage, so that medium income as a threshold. But when we say unincorporated, we mean those communities that are outside of city boundaries. They don't have city government, they have limited representation. They might be sort of either at their local water board, they can get sort of representation at that level, or they're going to their county board of supervisors to have some of their drinking water needs addressed. And part of the issue that we're finding in unincorporated communities, and this is not just a Valley issue, it's not just a West Side URWIM issue, it's prevalent in a lot of California's rural communities, is that they're lacking this basic infrastructure. So as we talked about earlier, a lot of them run decentralized septic systems. The water systems themselves have a lot of the issues that we've already heard from our previous speakers. And it's also other amenities that those of us that live in larger cities sort of take for granted: medical facilities, grocery stores, transportation. So all these things really challenge a lot of these unincorporated communities. And I also wanted to sort of take a step back to think about how we got here. The fact that we have a lot of people of color living in these disadvantaged unincorporated communities is not an accident, it's not a coincidence. There are policies in place, there's been centuries of disadvantage and exclusion for some of these communities. So when we think about sort of the legacy of these infrastructures and the systems and the legacy of the politics in these places, we just want to make sure we're holding the fact that there's been genocide of the Native American people, there's been Chinese and other immigrants that have become farm laborers and have been sort of kept on the outskirts of some of these city developments. And another sort of piece here is that as we think about city planning and city expansion of services, this picture of Fresno, I think it's from the 1930s, it's back before the Fair Housing Act, it's back when redlining was making certain types of people living in certain neighborhoods, and a lot of that residential distribution persists today, and that's part of the way that we understand disadvantaged and unincorporated communities in California. And then a lot of people have probably cited this Tulare County General Plan. It's not the only general plan from the 70s that talks about a sort of intentional disinvestment in these communities. So thinking about whether there should be public commitments to communities with little or no authentic future should be carefully examined. These non-viable communities would, as a consequence of withholding major public facilities, naturally decline. The fact is they didn't naturally decline, they're still here. They're still part of our vibrant rural California. And so when we think about addressing safe drinking water needs, it's important to hold this history as part of those long-term solutions. And so one of our sort of the main goals for the study that we did in the San Joaquin Valley that came out in February, and again for the West Side Urban study that came out in September, was to identify, map, and document the conditions in disadvantaged unincorporated communities, to highlight the problems of access to safe drinking water, and to ultimately inform policy and advocacy. So as researchers at Davis, we work alongside organizations like Community Water Center, Self-Help Enterprises, Clean Water Action, Leadership Council, other advocacy organizations to make sure that our needs and our research is addressing what we're hearing from the community. There are boots on the ground, they really understand the local reality, alongside technical assistance providers like we're hearing from today, to make sure that the research and sort of what we're learning from the secondary data that we've gone into is helping them move the ball forward on safe drinking water for everybody. So I'm not going to go through this long list of data. I just wanted to put it there so you have it as a reference to sort of get a sense of the resources that we used for our study. So we have 2010 census that's the most reliable for race and ethnicity, and we used more recent income data to think about who's living in which disadvantaged communities and the unincorporated communities. And then there was a 2013 PolicyLink study that first mapped all of these unincorporated communities. They made a parcel density decision of 250 parcels in a square mile. That becomes the community. And so the data that we're using for the valley-wide study is based from their initial layer. And then we use community water system boundaries to think about who is within those service areas. And so there's two big approaches of this study. One is a spatial analysis, so overlapping the boundary of where those unincorporated communities are with the water system boundaries to get a sense of if they're fully overlapped, we're going to make an assumption that they're fully served by that system. That's not always the case. There are islands and fringes, and sometimes those boundaries are not as accurate. But we're making the assumption if you're fully overlapped by the water service area, you're served by it. If you're partially overlapped, we don't know. We can't say one way or the other whether that unincorporated community has access to water. And then if you're not within that service area boundary, you're either served by a system where we don't have the boundary for it, you might be served by a state small because we only have sort of point location data, we don't know who's within their service area, or you're probably on a domestic well. And so that's sort of the spatial analysis, is really getting a sense of where those disadvantaged unincorporated communities are in relation to the water providers. And then the second piece of our work was the proximity analysis to try to think about, so if you don't have safe water, if you're on a domestic well, or if you're served by a system that's not delivering safe water, how close are you to the nearest system that is delivering safe water? So that's the proximity analysis that I'll show the results for coming up. And when I say safe water, we use the Human Right to Water portal compliance data. So we can talk about whether that was the right metric. There's different ways to think about this, but that's what we used just as sort of a statewide tool for that. So, and the numbers here correspond to the map numbers in the report, so they won't go in order, just for your reference to think about if you wanted to go into the study. So our first attempt was to think about which DUCs do the water system serve. And you can see the darker blue, let me make sure I get this right. The darker blue are the ones that are overlapped fully. And the lighter blue are partially overlapped, and the lightest blue, which you probably can't see on the slide, is the ones that are outside of the service areas that we have. And so our 2018 study found that there's 350,000 people living in unincorporated communities, disadvantaged unincorporated communities in the San Joaquin Valley, and 71% of them are in a service area. So there is a fair majority of these unincorporated communities that are getting access to water. The next question is whether it's safe or not. There's about 21% that we found might be served, so that's in that sort of partial overlap area. So one of the ways to resolve that is to get better water system boundaries, or you go to the ground in the communities to really figure out which houses are served by the system. And there's about 8% of the population is outside of a known or mapped service area, so that's about 26,000 people. So when we think about, this is a small fraction of California's 40 million people, but in some places where you have 100% of the people out of water, it's still not an okay thing in the 5th largest economy in the world. So that's partly what we're trying to document, is a bigger sort of understanding of what's the scale of the problem in these unincorporated communities. So the next question is, okay, so we figured out who has access to a water system or not, and is that water system delivering safe water? And again, it's a snapshot. It'd be great to figure out a way to do this more dynamically, so you're pulling from that portal database or whatever you decide is the right metric of safe water. And so you can see all the red sort of disadvantaged community dots on the map are those that are not getting safe water at the time that we pulled the data from the portal. And so this table, I'm just going to point to the 44,000 or so people that are getting water from non-compliant systems. So that's 57 disadvantaged unincorporated communities, and 1 in 4 water systems that were serving these communities were not delivering safe water at the time of the study. We also expect that the 27,000 or so residents on private wells might have safe water, might not. It depends how deep they are, where they are. But because we don't regulate that as closely, that's an ongoing thing we're trying to figure out. And I will say also, it's good to know that there are a majority of the residents that are served by a system, but we still want to get at everybody has access to safe water. Like 80% is not good enough. We want to get to 100. And the other piece for this, thinking back to the legacy of the ways that these unincorporated communities evolved in the valley, is that for Hispanic residents, they're only close to half the San Joaquin Valley population, but they're 68% of disadvantaged unincorporated community residents. So they're disproportionately living in these areas that are without access to safe water or without access to other city amenities. And so they're part of their portion of the DC residents. They're also a high percent of city residents that don't have safe water, and a high percent of the residents that don't have any water service that we could map at all. So the next question is proximity to safe water. So how close is the nearest system that's serving safe water? So the darker color is closer and the lighter color is farther away. So all those sort of magenta dots are those that are within 500 feet of a water system. And that could mean that it's actually in that system boundary, the boundary is wrong, or it has just been systematically not had service extended for lots of different reasons. And so just to sort of give you a schematic of the ways that we assessed proximity. So one way that we did it was a centroid to centroid. So you drop a pin in the middle of the DUC boundary, as to the middle of it, you have the middle of the water system, and as the crow flies, that's sort of the distance. And that probably means the pipe would be shorter because you're actually going boundary to boundary, or this doesn't take into account topography. So in the Central Coast, for example, you have a lot of hills, and this distance is actually probably a lot farther and maybe sometimes infeasible depending on what the terrain is. And the other proximity analysis that we did was what we're calling a least cost path. So if you think about the road networks, there's pipes there already, or it's easier to tear up the road and pull in a pipe. Our engineer was sort of thinking about what is the least cost way that you could extend service from an existing system to a nearby disadvantaged community. So here is the example of Porterville, which we all heard about during the drought. They're outside the city of Porterville. They have about 7,500 people in this little pocket of no service area. And the least cost path showed that they were less than a mile from the city. And so let me go forward to, well, I'll get back to that later. But the proximity analysis that we found, that first one, centroid to centroid, 44% are within 500 feet of the system, 22% are within a mile of the system, and a third are about outside that 3-mile boundary. So that is a different kind of conversation when you're thinking about long-term solutions. Is service extension appropriate? Is it a regional managerial consolidation? That's sort of a harder conversation to figure out, but that's part of why we're here today. And then this is the least cost path. So this shows that the majority of disadvantaged communities are, again, within 500 feet of the system. And there's about 9% that are a mile, and then 11% that are 1 to 3 miles, and then a similar 11% that are greater than 3 miles. So this is following the road network. So different ways to think about what do we mean to be close to safe water, and what does that look like in terms of ultimate project costs. So then going back to this example of municipal service extension East Porterville. So one of the things that the drought was good for, I suppose, is leveraging a lot of financial resources to connect communities like East Porterville. But one of the sort of unfortunate things is it took an emergency. It took thousands of residents to run out of water on their domestic wells before there sort of was public attention and media attention to extend service. So ideally we'd like to get to a place where this service extension is a thing that's happening before emergencies, so we're not investing in bottled water, hauled water on top of major infrastructure projects. And so some of our study recommendations, part of this is an improved enforcement of existing laws. We have SB 88 on the books. You can force consolidation. It's not happening everywhere, and it'd be nice if we could get more voluntary consolidations and sort of incentivize larger systems to take on small systems, but there's a lot of reasons why that's not happening. expanded and sustained funding, which we've been talking about, thinking about land use and annexation policies. So the reason we have 8,000 water systems is because water and land use are local decisions. And so that's sort of the legacy that we're inheriting as a state. And so now we have to think about, is that the right way to keep going, or do we want to sort of consolidate and regionalize, but do it in an equitable way, which I'll get to in a minute. Another piece is enhance and coordinate data systems. So it's great that all this stuff is coming up through the ORIM process. How does that align with the state board and how they're collecting data? And the state smalls is an outstanding thing. We had to go and do a Public Records Act request from every county to figure out where the state smalls were. So ideally, we'd have another sort of statewide list that shows for every county where the state smalls are and how close they are to some of our existing systems or some of the private wells. And then expand the study. So I'll get to this next, but this was just in the San Joaquin Valley. That's 8 counties. The Center for Regional Change just did another sort of 5 counties for their West Side ORIM. And if we feel like these are valuable analyses, is a thing that can keep being expanded outside of these initial study areas. So the 2018 West Side ORIM study was funded through that Prop 1, I think, disadvantaged involvement piece. Again, I have a list of the data, and then part of this was because that policy-linked data for disadvantaged unincorporated communities only exists in the Valley. The first attempt, or the first part of this project, was to figure out, well, where are the unincorporated sort of parcels or communities in these 5 counties? This was a little bit more rural, so we decided that it was 150 parcels instead of 250 parcels in terms of the density, and combined a bunch of these secondary data sources to figure out where the unincorporated places are and where the residents are in those. And then again, we did a similar proximity analysis to figure out, once we know where the DUCs are, how close are they to safe water? So this is sort of a map of the possible DUCs, and part of that possible is because MHI would be a snapshot. So we took an average across a bunch of different American Community Census survey data to figure out these have been disadvantaged in the last sort of 5 to 10 years. Are they still disadvantaged? And if so, then they would sort of fall under that definition of disadvantaged unincorporated community. And so just in closing is thinking about indicators of unsustainability or sustainability indicators of vulnerability or risk. One of the things that we, at least as researchers on this project, want to make sure is that you can't have a sustainable system if there are still structural inequities that deprive certain populations or places from full consideration and full participation in their long-term solution. And so rather than 5 indicators, I'm just sort of grounding us in these environmental justice and water justice principles to think about, can we come up with an indicator or a measurement or some sort of criteria by which we assess who is getting water and who isn't being meaningfully included in that decision-making about their water access or their safe water access or their affordability. And then also honoring and thinking about whose experiences and knowledge is and isn't respected. So part of what I've learned through interviews with water system managers and with community members is that there's a lot of local knowledge that doesn't always translate into engineering solutions. So thinking about the way that local politics or local relationships and sort of community social capital plays into successful solutions is part of this bigger story. So I'm gonna leave it at that. So we have some questions. You can find me, you can find Jonathan London, who's the study lead and the director of the Center for Regional Change, and then happy to answer questions. Cool, thanks.
Thank you, Amanda. Go ahead, Jennifer.
Hi, Jennifer Clary. Amanda, how do you think the shortcomings of the Human Right to Water portal as a data source affected your study? Because it's not really a complete inventory of systems out of compliance.
I think probably the biggest one is the E. coli, right? That's not included yet. And so we're missing a lot of those small systems that are probably side by side with all the septic issues. So this sanitation question is a big sort of outstanding issue. And that's one of the sort of challenges with using a statewide data set like that.
Do we have any other questions? Okay, well, good. I had some comments and thoughts while you guys are thinking about your questions. So we now have about 15 minutes before lunch, so we're going to try and take a break from 12 to 1. But I just, I had some thoughts listening to you and Amanda. I don't know if I, in the beginning, introduced what I do, and I am the Water Partnership Coordinator for Northern California, and so you were definitely singing some of my song up here, and I appreciate that. And I wanted to introduce Caitlin Juarez as well, who is our Southern California Consolidation Coordinator and Partnership Coordinator. But I was thinking as I was listening to you all, a lot of this is as much engineering or as much, we think about it from engineering, but a lot of it is the hearts and minds and making sure that everyone's included. So, and also thank you, Amanda, for the land use portion. I think that that's a really important and critical discussion that I don't think gets played out enough in the needs. So we have this time open, so if anybody else wants to do questions, we're happy to have it. I know we had a question earlier. If we want to take that now, we can as well.
Michelle?
Yes.
There's a question online.
Okay.
And it's directed to Holly.
Okay. Yeah, let's grab that one.
Okay. Does CRWA and the IRWM program sponsor any board and staff training? Here in LA County, the California Association of Mutual Water Companies provides HR training and other trainings to board members and staff.
Short answer, yes to the board trainings, and staff trainings are a little bit more one-on-one and maybe not as regularly scheduled, at least in terms of going to a water system, but like our CAC Rural Water has a whole series of trainings that, sorry, I'm not saying this right. There are board member specific trainings, and then there's another series of trainings that could be attended by board members and or staff, and which is all on the website.
Right. And also, I don't know, Katrina, if you want to answer the RCAC board trainings, if there's any kind of elements of that in there.
Our SRF funded program does include board trainings, and we typically have a brochure that comes out and lots of information on our website, but it's a little bit delayed with this funding cycle because the contract just got signed. So look for it in the coming weeks.
But you typically do a lot of different board trainings from year to year. Yeah.
Yes.
Yes. Yes, Marina.
Okay, Vanessa with Self-Help Enterprises. Just along the lines of the last question, I had a question sent to me asking about the financial sustainability of small water systems. So for systems that have 100 or less connections, where are we supposed to get the funding when it doesn't come from our ratepayers to have enough in savings for an emergency fund to address a well going out or emergency infrastructure needs? So that's, I think, something really important to think about. And I don't know if there have been any suggestions or ideas from any of the panelists or that have come up in our discussions. But I was just going to say that I really appreciated the last presentation, and I think that it kind of indicates that in addition to the TMF support and training that small DACs might need, we really need to look at water supply reliability, the water quality of our drinking water, groundwater, and surface water, especially in communities that might have all three. And our groundwater overdraft and climate change impact that might have more ramifications in these small disadvantaged communities, which might lead to supporting disadvantaged communities in project development and not only in support and finding out how to support them in TMF, but also help them develop projects that make their infrastructure and their systems sustainable. Thank you.
Darren, can I kick that question to you? I was just thinking with respect to, I mean, you used to be financial assistance, so maybe you can answer. I think that's an important question in terms of small systems.
The small systems, I mean, it's a really tough question, right? I mean, I've played with ideas like, should the state have an insurance fund that they all are required to contribute to, but then can draw from? I guess to back up, the way the system is set up now, it is an expectation that every system is an island unto itself, financially, managerially, technically. And when you're 100 connections, that seems unreasonable. So are there other state ways of applying that? There probably should. And I think, if you had something like that, there'd be consideration about it. But there's nothing now. What ideas can people bring to the table to do that?
Thank you.
Do you want to talk a little bit about regionalization and how that can help small systems?
To talk about regionalization. I mean, because as I'm sitting, we'll get you, Marina. As I was sitting there thinking about it, though, I was, really, whether it's coming together managerially or coming together physically and connecting, maybe teaching the skills of communication to, one area where you can have a facilitator and those kind of things that serves a certain area. So there are people that live in the community that share that person who's a skill set, has that skill set, or they share billing, or there's so many other ways that they could work together that I don't think they do in a lot of areas. And I'd also say we've had a lot of voluntary consolidations. In 2017, we had about 50. And then also in the past year, and I haven't pulled the numbers, and I apologize, I've been working on this workshop, but we're probably around 40 consolidations for this year. So we are seeing them. I know we have a lot of funding projects in the queue that are consolidation. So we are seeing a lot more happen, I think, which is wonderful. So Marina.
Javier Silva again with the North Coast. I also wanted to mention that I'm working with California Indian Environmental Alliance, contracted to them to do the North Coast outreach, and then they are also involved in the Sacramento River and Bay Area, and JoJo here is also part of doing a lot of that needs assessment gathering, so I just wanted to say that. But as far as the trainings and the board responsibilities, I think in the North Coast they have a toolbox that they created, a small systems toolbox, and I think that while trainings are great, it's not always easy to get to. Timing's all that is good stuff, but distance and all that. What we find is that this toolbox, give it to them, run through it. It's got capital improvement stuff, just templates and all that. I think that's a good first start because they see how much work is going to be required to do it and to actually see how it looks. And for small systems, I'm working with a lot of small systems that are 20 to 50. And so a lot of it, and with the tribes, we find not so much a regional, I can't say that word, and I don't like saying it, collaboration, but the idea, because the needs are, we can't fund our water operator because we get them up to a certain level of training, and they need to be able to survive, so they go off to where they can actually make a living, and the small systems can't afford to compete with that. So a lot of it is the funding, the money, right? A lot of systems are just poor, and so with the tribes, we're and with working with the Indian Health Service and RCAC, we're looking at maybe possibly, it's not so much circuit riding either. It's more of having a region, an area you can go to and have these water operators available to go out and do what needs to be done to these really small systems in a generally same region. So just wanted to say that. Thank you.
Michelle, question from the email.
Okay, thank you.
Amanda, is there a place where they can get GIS data for the maps in the report? Is it a public service on Esri or anything?
So the West Side URWM has a public service for that map. The San Joaquin Valley data is not online, but you can email us and ask for it. And then The Community Water Center project that I am helping to guide is going to create a web portal for some of these data layers that are specific to drinking water issues.
Can you talk about that portal a little bit more?
Yeah, it's still in design phase, but hopefully by the end of this year, the goal is to have water system boundaries. We're working with researchers to figure out where are the communities in California that are domestic well reliant. So that's sort of a merging of census population data and well completion report data in relation to water system data. We have a researcher looking at drought impacts to both domestic wells and public supply wells in the valley, but that's an analysis that could easily be picked up and done in other parts of the state. And this is partly Sigma funded, so the idea is going to be very groundwater focused, but I know that there's a group at DWR that has to think about drought for not just groundwater systems, so we're trying to sort of complement all these other ongoing tools. So come talk to me if that's a thing you're interested in, you want to help advise what that should look like.
And Amanda, are you going to be addressing this next Friday?
I'm not, but I think one of our consultants is
Okay.
talking about the supply impact analysis, but I will be there next week too.
Okay, thank you. Kurt?
One quick question. You had a very interesting slide about Tulare County. Do any of you get any traction with county planning? So these small unincorporated areas won't continue to grow.
Yeah, that's a resounding no.
Well, I don't know if the point is to not let them grow, right? They're supposed to do what they need to do as rural, resilient communities. You need people to be working in our fields, to be working in those hospitals. We don't just want to have rural California pack up and move to the city. So the question is, what do you do to make sure that there is safe and affordable and accessible water in these communities and do it in an equitable way? And whether that looks like a regionalization, I know Tulare County is also looking at sort of regionalizing between systems so you can pool rate bases. So there's innovative ways to think about rural drinking water resilience. It doesn't mean you can't move to these places or you don't want people to be there anymore.
Right, and there's, I mean, you know, this is coming up a little bit in Santa Clara County where we're doing some work, and you know, they're looking at trying to get housing for farm workers out in some rural areas. And, you know, we're also trying to look at other states' models for what rural communities do in other states, not just here in California, because there are some other more, you know, just out of the box ideas that could be found. But yeah, I mean, it is a, you know, we have Senate Bill 1263, which is supposed to decrease the number of unsustainable public water systems. But I think one of the offshoots that we're seeing of that is sometimes they're creating two-state small systems, or, you know, we're having some other thing, you know, sort of unintended consequences of that.
Yeah.
So.
And just quickly on that same point, to go back to Darren's idea of like risk areas. So all the recent fires, we had a question about land use planning and should we be rebuilding in these really fire prone areas, I think is a separate conversation from places that are drought impacted or in these sort of rural communities in the valley. So just another note on that.
Marina?
Yeah, I'm Steve Baker, Operation Unite. I'm a hydrogeologist. I know our small communities need a lot more than just the existence of groundwater, but my comment is really about the groundwater itself being there. We're looking for innovations just like everybody else. We completed a 10-year fractured rock aquifer study up in the Sierras and had some conclusions that resulted in us developing a groundwater management program and a monitoring program that would help these types of communities, and we have a demonstration site as well. The whole purpose is to give the information these people need, teach them how to use that information, and then we wean them of ourselves. That's the idea, and ultimately we're wanting to help them avoid issues related to a dewatered well that goes dry, and proactive behavior that looks for diversification of the portfolio, the water portfolio. And I'd be happy to talk with those who have interest in these types of things. Thanks.
Thank you. Caitlin. Hi, John.
I'm John Vandenberg of the RCAC. And going back to a previous question about affordability, I think the main responsibility of communities is themselves. They have to raise their rates to a point where they can sustain themselves. Then we get into the question of what is affordability. In some communities believe that 1% of their MHI is way too much. And then I'm working with another community where 13.5% is acceptable to them because that's what they decided. So then we come to the point, can people afford it? And there is a bill that was passed actually in 2015, and the state is working on the implementation of it, is finding subsidies for low-income people. And there are several ways of doing that, and the comment period on that bill is still open, actually. So there are people thinking about how we can raise rates to a point where communities can afford, or communities can pay for their own sustainability, but then subsidize the low-income people so we have a uniform rate. Under Prop 218, we cannot have different classes of customers. You cannot have one class of customers subsidizing the other. So there is the need for outside funding for the low-income people.
Thank you. For those of you that don't know John, he also does some fantastic modeling for water systems. He has an Excel spreadsheet, and they put in different rates, and they can evaluate different options, and we have worked a lot with him. And then you do outreach into the communities explaining how that works. I see a hand over here, Marina.
Yeah, Greg Thomas. I manage a water district in San Diego, so a public water system. So I just wanted to commend a lot of the panelists and the work they're doing. I think, you know, we're concerned about needs assessment within our own system and in others, and I want to commend it. But I think you've got to start on a lot of stuff. You know what Holly's doing, and through the IRWM program, there's a lot of assets and knowledge already being employed that I think is going to really kickstart what the state is looking at doing. So I commend everybody who's done that. You know, the challenges with operators isn't just for the small systems, and I think it's a little more challenging there, but we have our own silver tsunami, and I mean, we have our own, we're stealing from Peter, you know, our sister agencies, and then so that just causes even more problems. So I think it's an industry-wide issue. And I think, though, when you get to the rural and lower cost, lower paid places, people do start thinking about that. So there are some socioeconomic factors within the industry that we're looking at. But I think one of the things, and I think with Mojave is a good example, I think we as water agencies are more than happy to assist. I'll speak for my own agency. I know my board would support that, and I'm sure some of my sister agencies would too, not all of them, but I think you can get a volunteer like a adopt a water district program that we would definitely probably subscribe to. Yeah. I've done work with Water for People in foreign countries and other places, so I think there's a lot of models you can use. So, and we offer our assistance pro bono, of course, right, in those aspects. So don't forget to tap in to those actual agencies that are out there.
Thank you. I appreciate that. That was a great comment. You know, I would also say to the operator question, I was in a conference in Indianapolis, Wendy and I were, and there was a gentleman from Fort Wayne, and he had this fabulous program where they trained local teenagers on water operations and, you know, paid them a starting salary, and it was kind of an internship, and then they used that process to sort of fill out both theirs and other water systems around them. And you know, he said their community loved seeing their teenagers out, you know, helping out. And maybe they were, you know, junior college or whatever they were. But I can put you in contact with him too, because he was a great speaker. Okay, great. Excellent. Yes, please do.
As another example, Rural Water has recently implemented an apprenticeship program. So same kind of concept. And I believe we're looking for ways to expand it and more people who are interested.
Okay.
I'm fairly sure there's a web page on our site for it.
Thank you. Caitlin.
Hello, my name is Dustin Hardwick, Deputy Director with California Rural Water Association. I just wanted to bring up the point in regards to emergencies that might arise with these rural communities and available resources. What we have done is we put together a program with CoBank, which is a federal cooperative bank, and a small system can actually have a line of credit established where they can access this at any time. And I find this very beneficial. It's no cost to the utility to be enrolled in this, but if they were to have a catastrophic failure, at least they would be able to access funds to repair that form of infrastructure need within their community.
Thank you, Dustin. Yeah, we'll take one more, and then we're at noon, so we'll break.
Yeah, good afternoon. My name is Donna Begay, and I'm with the Tabatalabo tribe down in Kern Valley. I appreciate the tribal perspective that was provided a little bit in that report on the unincorporated areas. We have over 10 tribal allotments that straddle the water board, I believe regions 5 and region 6. And one of our biggest challenges today will be the protection of our aquifers in regards to the U.S. Bureau of Land Management's going into perhaps sell off open lease lands for the purpose of oil and gas fracking. So there's a big movement by the federal level to do that within California, and this first wave impacts the greater Kern and I think out there in Riverside area. So I was the one that asked about the GIS data, that will be important to do those overlays with the water system mapping that you provided, which was really, really interesting. So I want to just thank you. My tribal chair, Robert Gomez, talk about unincorporated challenges. Bandwidth couldn't quite get the webcast going. So we're out there at the very end of the DSL connection. So our baud rate isn't as good as like here down in Sacramento.
Well, you can also email us and we can send you a recording
afterwards. Thank you very much.
Okay, our pleasure. Thank you. And we'll break for lunch until 1. Thank you. Hi, everybody. I think we're probably going to wait 5 more minutes just for everyone to get back, since it seems like we're still missing a few people here. So we'll try and start around 1:05. Thanks. Can you turn me back? We're going to get started. If you guys could take your seats, I'd appreciate it. Thank you. I know. At some point, we just got to go. So. Yep.
Lauren.
All right, we are going to get started here today for the second half. So I would like to welcome Carolina Balaz. She is a research scientist at OEHA, and she is leading the development of a human right to water framework and tool. She has over 15 years of experience in drinking water and looking at health impacts and social disparity. So hopefully people will come trickling in as we're doing this, but I know you have really good stuff to share, so thanks.
Exactly. Okay, great. Well, good afternoon, everyone. I'll be presenting on a framework and tool for evaluating our progress in achieving the human right to water in California. And some of this was touched on in the morning, but I'll briefly revisit it. In 2002, the United Nations enshrined General Comment 15, which establishes the human right to water and focuses on having safe, acceptable, accessible, and sufficient water internationally. And 10 years later, in 2012 in California, AB 685 made California the first state in the nation to legislatively establish the human right to water here in our home state. So indeed, a vast array of water challenges exist across California, as the speakers were discussing this morning, from the Central Valley communities to the Salinas Valley communities, from urban areas in LA to rural areas in the Eastern Sierras and the Coachella Valley. And to address these challenges, measuring and tracking the issues is key. Recognizing this, OEHA recently, just a few weeks ago, released a draft report, which is shown here. And this framework and tool, it proposes to monitor progress in achieving the human right to water by looking at 13 indicators of water quality, accessibility, and affordability, starting at the community water system level and having a statewide application. This represents the first state-led effort to holistically assess these three areas of drinking water quality, accessibility, and affordability. So drawing on the notions of AB 685 and the human right to water, our framework has three components: water quality, water accessibility, and water affordability. And as I mentioned, there's 13 indicators that help to characterize those different aspects. The indicators were selected based on their broad relevance, but also on whether there was adequate data quality, coverage, and public availability. And we propose to evaluate data from 2008 to 2016. What the framework and tool allows us to do is to think of water challenges in a holistic sense. So at times, we might want to look at what are particular water quality issues or affordability issues or accessibility issues. But we also know that some water systems have multiple types of challenges. So what's the interrelationship between low water quality and low affordability? Or what types of water systems have problems in all three areas? So shifting gears, I want to provide an overview of what our indicators are. The water quality component has 7 indicators, and it relies on data from 19 contaminants that are listed here. We selected contaminants based on whether there was significant coverage of water quality data or whether there was a high priority contaminant based on how many MCL violations it had. We have 2 types of water quality indicators. The first is compliance, the second is exposure, and this diagram here is meant to give a flavor of why we have both. So certainly compliance is important because it helps establish whether water systems are meeting regulatory goals. So on the left-hand side of this figure, you see points A and B, where a system with a groundwater well and no treatment, compliance typically, depending on the contaminant, but typically it's MCL violations are issued at the source level or at the treatment facility if there's treatment. But what compliance doesn't necessarily capture is what are the public health threats of exposure at the tap. So that's point D at the top. And if we used estimates of average delivered water quality, that can help us get closer to what's potential exposure at the tap. So for these reasons, we propose both areas of indicators. Sorry. I think it's, oh. There's no input signal. Okay, sorry. Should I just, I can just talk to the, I'll talk to this. I'll just, yeah, that's fine, okay. Okay, so data sources for our exposure indicators, we propose to draw on the water quality monitoring database, which allows us to estimate contaminant concentrations on an annual level. And for compliance indicators, we draw on the SWRCB database, which has a running tally of MCL violations for water systems. So our 7 water quality indicators, on the exposure side, I'll give you a brief overview of these, but the first is potential high exposure. So this gets at how many contaminants have an annual average concentration that exceeds the maximum contaminant level, or the MCL. And then we have a second indicator that says, are any of those contaminants acute contaminants, nitrate, perchlorate, or fecal E. coli? Then we ask with our third indicator, what's the maximum duration of potential exposure? So this gets at how long is this potential exposure lasting? And finally, data availability is important. We ask, do we even have water quality data to estimate this? If we don't, that means customers in that system may or may not have information on their water quality. On the non-compliance side, or compliance side, the first indicator is what's the non-compliance with primary drinking water standards. So how many contaminants received at least one MCL violation in our time period? And were any of those acute contaminants? And then finally, what's the maximum duration of potential sorry, that's a typo. What's the maximum duration of non-compliance? So how long were there MCL violations for? So taking a hypothetical example, if we think of a system that has been facing arsenic issues, I wanted to give a sense of how we could use the information from our framework and the resulting tool. So let's say the system has arsenic problems. It would show up as having potential high exposure. And if it had 9 years of arsenic between 20 to 30 parts per billion, it would show up as having a maximum duration of exposure of 9 years, which is a lot. It would be every single year of our time frame. On the non-compliance side, we could assume that it also has arsenic problems and has been issued MCL violations, but maybe there's 5 years of MCL violations. So some of the data might look the same between exposure and compliance, and some might be slightly different given how the measures are calculated. Moving to water accessibility, so broadly speaking, water accessibility entails physical quantity of water, the availability and reliability of supply, what's the source type and collection time, and is it economically accessible? This last one, economic accessibility, I'll talk about in the affordability section, but usually in the Human Right to Water framework, it's discussed under accessibility. So at OWIHA, our current focus is to look at system-related characteristics that can impede access. And so we break these into 2 areas, physical vulnerability and institutional vulnerability. So for physical vulnerability, we currently have 1 proposed indicator, which is what's the physical vulnerability to water supply outages. And to get here, we would calculate what's the source type and how many sources does a system have. For institutional vulnerability, we have 2 proposed indicators. One is what's the institutional capacity of the system as a function of the size and its disadvantaged community status. And then what type of managerial constraints does the system face? To get at that, we look at how many monitoring and reporting violations does the system have as a signal for potential managerial constraints. The data sources for these indicators are both the SWRCB database that has information on system size, source type, and also census data to calculate median household income and determine disadvantaged community status. I'll point out in terms of gaps or future directions, as I mentioned with the earlier slide, water accessibility has many other dimensions, and so we would hope to add to this list over time, but in a first phase of proposal, this is what we're proposing. So taking a hypothetical system again, we could imagine there's a system with 1 groundwater well. So physical vulnerability would indicate 1 groundwater well. And in terms of institutional vulnerability, it's a small system with 50 connections and an MHI of about $42,000, making it a disadvantaged community. And in terms of managerial constraints, the system might have 10 monitoring and reporting violations. So this is the kind of information we would expect to generate with our tool. For water affordability, we have 3 indicators, and they all draw on the basic concept of what's an affordability ratio. And so just generically speaking, you can think of an affordability ratio as what's the monthly water bill at a certain amount of water relative to a certain income. So for our proposed affordability ratio, we look at what's the monthly water bill at 600 cubic feet per month, and then relative to a particular income, which I'll get into here. So we have 3 indicators. The first one is the affordability ratio at the median household income level. This is most parallel to conventional affordability ratios. We've done some adjustments to address critiques from the literature. So this gives us kind of for 50% of the customers or for customers earning that 50% level of income, what's the affordability ratio? The second 2 indicators get at more economically vulnerable households. And so here we calculate an affordability ratio for the county poverty threshold. And this is a threshold that's calculated and proposed by the Public Policy Institute of California, but it's basically what's the basic expenditures that a family of 4 would need to have to stay just out of poverty. And what's nice about this measure is it adjusts for a variety of cost of living expenditures across California counties, and we know that there's a great variability in income, housing costs, and different cost of living. So that's what we do for the second indicator. And the third indicator is basically the most economically vulnerable, and so it's looking at affordability ratios for those in deep poverty, which is defined as half the county poverty level. So we hope to kind of progressively capture the burden on more and more economically vulnerable households. The other thing that's important to note is that those 2 latter indicators, in essence, are potential affordability ratios. Until you know how many households are earning that level of income, you don't know how many people are impacted. So we also propose to calculate that proportion of households. The data sources here are the State Water Board's electronic annual report that has information on water costs, and then census data to calculate income levels, as well as the poverty threshold calculations that are calculated by the Public Policy Institute of California. In terms of gaps, we know that there's about half of the systems or at least half of the community water systems lack water cost data. So filling that gap is a key thing to consider to actually capture a full statewide picture on this. So a hypothetical example here for water affordability is if we consider a system that has a monthly water bill of $72 per month, and they have about $42,000 of median household income. County poverty is $25,000, deep poverty is around almost $13,000. So what we would have here is the affordability ratio at the MHI would be 2.1%. The affordability ratio for the county poverty threshold would be 3.4%, and for those in deep poverty, it would be 6.8%. And for those last 2 indicators, I also give an example of how many households might be facing that situation, which is important to temper the value with. So this slide gives a schematic of how we can take some of that information I gave from the hypothetical examples and think about what information the tool could allow us to do when looking across systems or across time or across regions. So in red is system A, which is this hypothetical system. And the darker the box, we could think of it as higher concern. And so you could conceive of an approach that would give us, for different indicators, which ones are showing up as higher concern or lower concern. So you can just look at one system, and then you can also say, how does system A compare to system B, or how might one region of California compare to another region? So in conclusion, our framework and tool summarizes 3 components and has 13 indicators to help summarize those components. It offers a holistic view that allows us to look at interrelationships between these various aspects of water and drinking water. It offers big picture trends or the ability to look at big picture trends across systems, across regions, and across time. And yeah, the last point, it helps capture how those trends might change over time as well. So in conclusion, I have up here the site where you can download the report and find out more information. We also have hard copies in the back. We have a webinar coming up. We're open for public comment right now. So please check out the site if you want to provide public comment, and my contact information is there. Thanks.
Yeah, thank you. Thank you. So I think one of the nice things is really seeing all the different work that's being done here. I mean, it's great to see that, how much has already been put into this. So thank you. Do we want to take questions? Do we have any questions out there? Cindy? Oh, they're going to run you a mic.
This was great to have your presentation today. Thank you. I'm just curious, is this like the first public process step and then you're going to have the webinar and public comment, or was there anything before, outreach or workshops or anything else on the framework?
This is the first kind of public discussion of this. So our real outreach effort will start with our webinar on January 23rd, and then we were lucky to have the Water Board have us present today, but our formal public process is on the 23rd.
Thank you.
I think we have another question down here.
Thank you, Jennifer Clary. I had a question about the water quality indicators when you're looking at the exposure. Are you only looking at exposure when it's above the MCL? Is that what you're limiting it to?
For now, that's the proposal, is to take annual concentrations relative to the MCL. There's reasons for that, mainly because of data constraints on what the public health goal allows us to do. But this is a draft, and we're looking forward to comments and conversation.
Great, thank you.
Okay, thank you. And our next panelist is Laura Feinstein. She's a senior researcher with the Water Program at the Pacific Institute, an Oakland-based research organization specializing in sustainable water management. Her current research focuses on access to drinking water and sanitation for disadvantaged communities and the water energy nexus. There we go. Thank you.
Hi, everybody. Thanks for coming today. It's been a really interesting session so far. I'm going to talk about measuring progress towards universal access to water and sanitation in California, and give you some of my thoughts on indicators of vulnerable systems, as well as how we can start to relate those indicators to the outcomes that we're actually concerned about, which is whether or not people have safe, accessible, affordable water in their homes. First, a little background on Pacific Institute. We are an independent nonprofit research organization. We create and advance solutions to the world's most pressing water challenges by producing research that advances a sustainable environment, healthy economy, and social equity. So today I'm going to divide my talk up into 3 parts. I'm going to talk about indicators of unsustainable water systems, as you've heard everybody touch on so far. Then I'm going to start talking about goals and performance indicators for drinking water, and then wrap up with some conclusions and recommendations. So first, to talk about indicators of unsustainable water systems. I decided when I was asked to think of a few, I think I was directed to think of 5, and I eventually culled my list down to 8. But I tried to focus on information that is or can be collected for small water systems, because there are many indicators that are collected for the urban water suppliers that are not collected for small water suppliers in California. So I tried to focus on those that are collected for the small water suppliers via either the sanitary surveys that are conducted by Division of Drinking Water or the Small Water System electronic annual reports. There are some other good data sets out there, but that was sort of my starting point for some good, comprehensive, digitized databases. Actually, I don't know if the sanitary surveys are digitized. Need to find out.
Not really.
Maybe not. Maybe they need to be. So this was the list of vulnerability indicators that I came up with. And I'm not actually proposing these as the top indicators. I'm kind of putting these out here as some of the indicators that I think are often circulated as common sense indicators of whether or not a system is functioning well. And I'm going to get into a little more detail on how I think we could develop a process to decide which are the best indicators with an evidence-based process instead of doing it sort of intuitively. So these are some of the categories that I see as some of the important ones to look at for vulnerability. So I've listed them here: environment, supply, economies of scale, financial capacity, et cetera. I won't go into all of these in detail, but a couple of the ones that I think are worth talking about that often get sort of suggested, and I think we've already heard today, are this idea, for example, of economies of scale. Do I have a light here? I don't know. I'll just wave up there. So economies of scale is the system under some certain number of service connections. People often kind of throw out these rules of thumb, maybe 100 service connections, maybe 200 service connections is just too small to be financially sustainable over time. But we haven't really done, I would say, the evidence investigation to back up that assertion. I think some of the other indicators that are often commonly suggested are things about infrastructure replacement rates. So I've put here, are the water mains replaced at a rate that's consistent with industry standards? Water main break rates and water leak loss is also information that's collected. Are those rates higher than our standard? And then I think we've also heard people talk about rate increases. So I have here under governance, if there's been no rate increase in some certain number of years, that seems a likely indication that they're not keeping up with the economic and financial demands of running a system. But as you might notice, I've put it here in tandem with some other observations. If you have a system that doesn't have major increasing costs to operate, you may not need to raise your rates as often as some other systems. So for example, I think some of these indicators need to be looked at in tandem with others. So if a system hasn't increased its rates in a certain number of years and we're seeing low infrastructure replacement or a high rate of Safe Drinking Water Act violations, that's a red flag, not necessarily a failure to increase rates across the board, right? So I don't think that we should necessarily just start grabbing indicators based on observations. I think that we need to start with a large number of potential indicators that we cull from some of the statewide data sets and validate them with a statistical process. So there's actually there's a typo in this slide, so I'll correct it. So what I'm showing here is a hypothetical simplified model, right? This is not really what a statistical model looks like, at least not anything that's beyond like Stats 101, but it works for this presentation, right? And so what I'm showing here is that we think that annual reporting and monitoring violations are an interesting indicator potentially of a system that's not functioning well. So that's not a system that necessarily is having health-related violations, so they wouldn't crop up necessarily as having, for example, they're exceeding their MCLs on a regular basis. But we think that perhaps having a high rate of reporting and monitoring violations eventually is going to lead into them having health-related violations a few years from now. So you would see in your data set whether or not that actually correlates with a time lag a few years down the road to health-related Safe Drinking Water Act violations. And this indicated here would be that you do see a correlation. Ignore the fact that I wrote no correlation. But you also might find that some of your favorite common sense indicators, in fact, bear no actual mathematical relationship to the things you're actually interested in. And then you have to be willing to throw them out. Or you might find that some of your common sense indicators are duplicative. They essentially end up measuring the same thing. You don't need to collect 100 indicators, maybe, to figure out which systems are most vulnerable to failure. You might be able to winnow that list down to a much smaller list and be more effective with your time and money. So I'm going to shift from that discussion of vulnerability indicators into defining goals and performance measures. So I think one of the things that's important to keep in mind here is that we've been talking a lot about things like, does the system have certified operators on staff? Are they taking in enough money to cover their costs, et cetera, et cetera? All these sort of technical details of how you run and operate a water system. But what we're actually trying to do is connect that to whether or not people get safe, affordable, accessible water in their homes. And so I'd argue that we've kind of been talking about two different types of indicators or measures today, and we need to think about them as being in separate groups. We're talking about vulnerability indicators for whether or not a system operates well, and we're talking about performance measures for whether or not people are actually receiving good quality water in their homes. And we need to be thinking about those as connected but distinct. So I'm going to talk a little bit for a while now about what I think are the performance measures that we're actually aiming to achieve in terms of safe, affordable, accessible water. So we came out with a report a couple of months ago that's called Measuring Progress Towards Universal Access to Water and Sanitation in California. And what we try to do in this report is to really come up with some very consistent and measurable definitions for what we mean with those terms, safe, affordable, accessible. Because I think as RCAC pointed out earlier, if you go and ask 10 different people, is your water affordable, even in the same area, you'll get 10 different answers. Those aren't terms that everybody understands in the same way. But yet we've defined them as statewide goals under the human right to water, so we need to start to develop a statewide understanding of what we mean when we say that. So we took an approach that's modeled after what's used internationally by the World Health Organization and the United Nations Children's Fund. They've been monitoring for many years now access to water internationally. And the way that they do this is they monitor using a set of service ladders. And this approach is useful in the sense that it simplifies the data enough so you can start to track major trends and make comparisons across large regions. But at the same time, it doesn't simplify it so much. So you aren't, for example, saying, is your water affordable or not? You aren't saying, is your water safe or not? You're ranking it among about 5 different categories, so there's some complexity there, but not so much for it to be overwhelming. But the thing with the international approach to service ladders is that their standards for what is safe, affordable, accessible water wouldn't really meet California standards. So for example, safe water as defined by the World Health Organization and United Nations Children's Fund means that it is free, I think it's of arsenic, and bacterial contamination, and that's it. So they aren't looking at a lot of the hundreds of MCLs that we look at. They aren't looking at lead, for example. They aren't looking at all the ones, cadmium or whatever it was that Carolina was listing. So we developed California-specific service ladders for safe, affordable, accessible water and sanitation that reflect the sorts of norms and regulations that are prevalent here. And we were trying to be careful to align with laws and regulations because we want these to actually align with things that you could enforce theoretically. And we also made a big effort to align them with already existing public data sets. So we weren't necessarily trying to propose a number of indicators that would require that we found the new Census Bureau for water in California. Rather, we wanted to align them with the information that's largely already being collected in the state. So moving on to safe drinking water. So one of the issues around how the term safe drinking water is commonly used is that it's often used to simply say, your water is safe or it's unsafe. But we don't necessarily say what we mean by that. There's approximately 100 enforceable standards under the Safe Drinking Water Act, such as the maximum contaminant levels. There's also treatment techniques that are enforceable. When we say water is safe or unsafe, which one of those are we talking about? How long has a violation occurred? Has that violation been persistent? Was it extreme or was it very minor? There's often sometimes some conflation between, for example, a failure to monitor or report properly, which is different from an actual health-related violation. So we tried to think about this with a little more nuance and care and defined our safe drinking water service ladder. We defined the goal for safe drinking water as being that chemicals regulated by the state and federal Safe Drinking Water Act standards should be consistently below levels that pose a significant risk to health. So how would you actually measure that? You would measure that, as we were putting under the household level performance measure, that a household served by a public water system that has been without an enforcement action during the last 3 years for state or federal Drinking Water Act standards would meet a satisfactory standard for safe water. And then we go down from there through a moderate and a marginal and an unacceptable level. And you may notice that we are suggesting measuring these things at a household level and summarizing them regionally by numbers of households that fit into different categories, as opposed to just thinking about system level. The justification for that is that we want to, in one place, be able to capture both those households that are served by the community water systems, but also potentially those households that are not, those households that are on the state smalls or the domestic wells. And also those people that lack plumbing and access to the local water system, which is a problem in substandard housing and for the homeless as well. The next thing that we focused on was accessible drinking water. We were interested in a number of different components of access. We wanted there to address the continuity and quantity of water that's available in the home. And we did some work to think about what is an actual reasonable amount of water to use on a daily basis in California. We used the residential end use studies that have been conducted in California to develop this calculation that 43 gallons per capita day is typical average indoor water use minus leaks in California. We focused on hot and cold running water because that's the data that's available in the American Community Survey, and also because that is what is required under the Civil Code and Health and Safety Code for buildings. So our goal is that water should be available in sufficient volumes to meet domestic needs at hot and cold temperatures in a location near home and at the times needed. And a satisfactory performance measure would be that a household has at least 43 gallons per capita day of hot and cold indoor piped potable water, and it should be available 24 hours a day, consistently over time. And last, affordable drinking water. Affordable drinking water has historically been measured as the cost of an average water bill as a percentage of median household income. This has always been an issue because there are, by definition, 50% of the households are under the median. So you aren't tracking the impact of water bills on your very low income households when you're only looking at one median household income. This metric has also usually relied on an average water bill. So you see the phenomenon where if you do a big analysis, you find that systems that have very high average water use because, for example, they are horse farms or they have very large lawns, look like they have affordability problems, but they are not low-income communities. So we wanted to focus on essential indoor water needs rather than average indoor water need or average total water needs. And we wanted to consider the local cost of living because especially in California, it varies radically. A household earning $50,000 a year in Tulare County has very different discretionary income than a household earning $50,000 in San Francisco. And we wanted to consider the cost of both water and wastewater if possible because households often, although not always, are paying those on the same bill. So if that combined bill is very large and they fall behind on it, they can get disconnected from water and wastewater services jointly. So we wanted to think about the affordability impacts of them together. So we defined the goal of affordable drinking water as being, and wastewater, I should say, as the cost of essential water and sanitation needs should be inexpensive enough. The cost does not prevent access nor interfere with other essential expenditures. So basically, you would want to see that a household doesn't have so much difficulty paying its water bill that it actually results in debt or a disconnection. And you also don't want to see them making trade-offs between paying their water bill and necessities such as medication or food or shelter. How do you actually numerically define what that means is tricky. what we suggested is that you would want to see a household spending less than 10% of its discretionary income on essential water and sanitation needs. So discretionary income is total income minus taxes, shelter, food, medical care, all those essentials that you need to survive. What's left over is your discretionary income. And we're saying, is a household spending more or less than 10% of what remains on their water and wastewater? 10% initially might sound like a lot because we're used to hearing figures like 1.5 or 2%. But it's important to recognize that that denominator of discretionary income is vastly smaller than total income, especially for low-income households. Low-income households have often close to zero discretionary income. So 10% of discretionary income is quite a modest amount to pay on water. It typically comes out to about $40 a month when you start to look at what the figures add up to. The other thing I think that's worth pointing out here is that in some ways this looks similar to what Carolina is proposing, but we essentially kind of flipped what you're calculating for. Rather than saying, does a household earning X amount, can they or can they not afford their water? What we said is, let's calculate how many households in a given area are having difficulty affording their water. So it's the same inputs, but you're solving for a different part of the equation. And I think it's more interesting to be able to say how many households in a given area are having difficulty affording their water and compare that number than to focus on any individual income point. So next steps. I would say that one of the most important next steps in this process of starting to coalesce around a goal of safe, affordable, accessible water for everyone in the state is that we need to develop a shared understanding of what we mean by those terms and what our goals are. For the purposes of using this report, the service ladders are intended to be customizable. This is not a line in the sand. We think this is the only way to measure these issues. Rather, we're trying to point out what we think are the major components that need to be considered in thinking about goals for drinking water in the state. There are existing public data sets available to start filling in some of the numbers on performance measures. And we think this would be a useful process because it allows you to actually identify problems proactively. And to see whether or not some of the programs that you're putting in place are actually affecting these numbers, right? So if you are funding a particular assistance program in an area, are you seeing your indices of safe, affordable, accessible water increasing over time or not? It's a good indication of whether or not your funds are well invested. So to circle back to the initial discussion of risk or vulnerability indicators, I was saying that I think that there's really two categories of indicators that we've been talking about, and it's important to think about them as separate but related. We're talking about risk indicators in the sense of, is a system likely to fail in the next period of time, year, 2 years, 3 years? And then we're talking about, do people have safe, affordable, accessible water in their homes? And I think it's important for us to start thinking how we're going to rigorously connect those two types of indicators, rather than, for example, coming up with a large number of technical, managerial, and financial indicators that have a common sense appeal or that have been cited in existing reports, and simply focusing on those and not necessarily validating that they connect to what our desired outcomes are. So what I'm showing here, again, hypothetically, is that for number of service connections, which is something that people often will say, if a system has under 200 service connections or 100 or whatever it is, they're going to have trouble delivering safe drinking water. Well, let's actually test that. You can put number of service indicators into your model and see whether or not at some point down the road, those systems tend to start reporting high numbers of health-related violations. You could conceivably look at public water systems that have increased in size over time and see whether or not, as they increase in size, does the number of safe drinking water violations start to decline or not? This is a simplification. I think you would actually try to put in many indicators and you try to be testing them simultaneously and see which ones are duplicative, which ones are useful, which ones are complementary. But I think we need to be thinking about a systematic approach to making sure that our indicators actually tell us what we want to know. So I'm suggesting here that we start to think about connecting them both to health-related Safe Drinking Water Act violations as well as unaffordable rates, and then also to indicators of access, such as water outages during drought. And so this is a little overview of what I think would be a reasonable approach. We would propose a number of indicators or a set of indicators, validate them against a performance measure, and if they correlate, retain and use those indicators. But if they don't, either retest with a better model or discard those indicators. So I think we need to be very careful and rigorous about this development of indicators. And with that, I'll leave you with pointing you to the Measuring Progress report. It's available on our website. It has far more information in it than I could ever squeeze into a PowerPoint on the service ladders and how we develop them and how they relate to international frameworks for measuring water and sanitation. We also relate it to data sources that are available and how you could start to fill in these categories with some real numbers. We will be coming out with a report on sanitation in California in the next few months, so look for that. And with that, I'll take questions.
I have a question for you. I have a question out to the general audience too. I mean, I like the idea of the performance indicators and determining, whether or not we see them. Has anybody done that? I just don't want to duplicate effort if some other organization has already looked at that. There's a.
I'm sure you know about Maura Allaire, I believe is her name, at UC Irvine. Yeah. Did a study in PNAS on a lot of these indicators, and I think she did do statistical correlation. She was looking at a national data set. It did not include any state smalls or anything smaller than a public water system.
I can add to that. I mean, there's a few people now who've looked at the correlation between system level factors and violations, but they don't really get at besides system size, they don't really get at the other TMF metrics that we're discussing here. They're more focused on, exclusively system size, governance type, and the socioeconomic characteristics of the population, maybe water source type. There's a few of those studies coming out, but I don't think they get into core, particularly financial metrics at the system level.
Keep going. I think we could take one more.
Hi, Laura. Greg Thomas. Quick question for you. I'm trying to wrap my head around the fact that you're placing water as a discretionary expense, given the fact that humans can survive basically 7 days without food, but no longer than 3 days without water. And if I recall correctly from my grade school days, food, shelter, water, clothing were the 4 basic needs of a human to survive. So I think that might be a little interesting. I don't see how you can place water as a discretionary expense over maybe gas in your car, driving a Toyota Camry versus something else, or how that works, because that's very selective and elective or subjective in regards to discretionary.
Right. So the way we actually define the formula is that we're interested in what proportion water is of what's left over after you spend your money on your non-water essential expenses. So you take your income. Water is essential for life. We agree. So you take your income and you subtract all the other things you have to spend money on: taxes, food, shelter. You're left with non-water discretionary income, which is a mouthful, but that's what we're actually talking about. And then you take water as a proportion of non-water discretionary income. Why would we do it this way? The point is essentially to factor in the fact that a household making the same amount, like I was saying, $40,000 in San Francisco, has a lot less left over after they pay for rent and food and taxes than a household making $40,000 does in a rural area of the state, for example. That's why we're taking non-water discretionary income as the denominator. But absolutely, water is an essential expense.
Thank you. Thank you, Dr. Feinstein. And next we have Jeff Hughes, who we'd like to give a special thank you to for coming all the way out from North Carolina. Jeff Hughes is the director of the Environmental Finance Center at the University of North Carolina. He provides applied research, educational programs, and advising services to local governments, non-governmental environmental organizations, private environmental providers, utilities, everybody. 30 years of environmental finance experience in a lot of different activities. So please welcome Jeff.
Thank you very much, Michelle, and thank the other presenters, the ones this morning, excuse me, and the audience for your questions. I'm a complete water finance and governance geek, and the idea of coming out and spending the day with you all is about as exciting as it gets for me. Some people want to go to Disneyland or the beach, but give me a good dose of California water policy and I'm happy. So in all seriousness, I work across the country, but there's a special part in my heart for some of the interesting, in quotation marks, water challenges in California. So over the years, I have been tracking and working a little bit with some of the other presenters. So again, I'm really happy to be out here. But with that said, I know much less than most of the other presenters here from a California-specific standpoint. I think what I was invited to talk about was a little bit more of some of the outside California perspective. So that's what I'm going to do. Just a little bit more about the organization I work with. We're part of a university, but we're a very applied part of the University of North Carolina. We work on some traditional research projects, but we also do quite a bit of teaching and outreach, some technical assistance, similar to what you might have RCAT, Rural Communities Assistance Corporation, or a water do. So we do a lot of different things. So a lot of it touches the issues that we've been talking about today. Specifically in the water capacity side, and I should add, we also work on energy and some other topics outside of water as well. But on the water side, you probably can lump our work into two categories. We work with utilities. We have a lot of rate setting models and utility kind of capacity assessment tools that they can use. We do a lot of training for utilities. But then we also work on the research side with organizations like different state funding agencies, and so we're really coming at it from both sides. So some of the work that we do is more, you could think of it as how do you know that you have a problem if you're a utility, and what can you do? And other of our work is more to try to inform when you're trying, you have the responsibility for deciding, okay, there's 1,000 utilities out there, which are the ones that maybe we should be watching. So we do a little of both. I was going to start with my homework assignment, and that was to come with 5 indicators. I didn't quite follow directions. Sorry, Michelle. I think I was supposed to. I think I was supposed to bring my 5 top ones, and you can't make me do it. I'm not going to say top. These aren't even in order of importance, but these are things, more than anything, these are things that sort of are the things I've been thinking about the last couple months. I probably have 20 indicators that I would have to share with you if you wanted me to say it all. But these are ones that have just come up. They're indicators of interest that have been pretty important to our work just in the last couple years. So I thought I would just talk about them a little bit. And also I figured that they would be a little bit different than some of the other presenters because I am coming from a little bit more of a financial centric approach. But the first one I think is important for an indicator of concern, and that's some metric related to how much stuff per household the utility is responsible for. And I put more focus on these types of indicators than the pure number of customers. But we have seen, to your question, Laura, a big correlation between really small systems tend to have miles of pipe that they have to cover per one account, or thousands of dollars of assets. And that's just hard. You know, when you say one family is responsible for $100,000 of water infrastructure in the ground, you know, which in some cases, when you do the math, we actually see, it's not surprising that all of the other problems kind of arise. So there's a bucket of those kind of indicators that we've been tracking for some of the places we work. Population decline and growth. North Carolina, like a lot of states, probably like California, is really a state of two communities or two types of communities. We have this high energy growth part of the state, and then we have a lot of North Carolina that's really is not, has suffered with loss of large industries, loss of population. So when we look at the population growth and rates and decline and some other demographic statistics, we start to see really stark things. And we're working with some communities that have had compliance problems where you look at the trends of the population and they've lost 20% or 30% of their population in the last 10 years. Or, you know, there's a whole host of indicators that are really interesting that we're starting to do research on. The average age of the person in the community is really, again, sadly interesting. We're working on communities where if you look over the last 10 years, it's been creeping up every census. So we have places where the average age is 58, 59, 60, which doesn't sound bad for me given my age right now. But when you're looking at who's going to be paying for the bills, you know, if you do a 30-year loan, we were talking about this earlier, if you follow these trends out, it looks pretty bleak in 30 years with the number of people that are actually going to be there. So I would say to pay attention to those indicators. You know, we're all about revenue, and we've seen, again, in North Carolina, a big issue with overnight the chicken plant or the manufacturing plant leaves. So we urge, when we're working on a community basis, first thing we do is identify, you know, where is most of your money coming from? Have you talked to them recently about, you know, are they planning to leave anytime soon? What we've seen, even in the urban, well-developed areas, we've seen this, it's two ends of sort of the sustainability clashing. We've started to see a lot of exciting water reclamation, water recycling processes being enacted by sort of traditional industries, and they don't necessarily tell their utility about it until the utility's saying, wait a second, how come we sold 50% less water to the widget manufacturer last month? It's because they hired a nice sustainability director to go in and do a reclaimed system in their facility. And I mean, this is a little bit in the details, but these are the kind of things that we ask for. And it's starting to have a big impact on some communities where they're not really treating their business like a business. They're not paying attention to customers. So this is an indicator that gets at that. This other one is like a yes or no. Do they have some type of management or leadership? We just did a survey in North Carolina, and this came out to be statistically significant in a lot of ways. You know, if they have no access to professional management, you know, and it could be they might share something with their general government, or they might share a manager. But if really it's only a contract operator, are they going to be able to even understand some of what we've been talking about? You know, operators are incredibly important too, but the water and wastewater business is no longer for just the people with hammers. I mean, there's a lot of high level, we heard it earlier today, kind of legal water rights access. So, you know, having some managerial expertise. And then the last one, you know, which I would always put first, is a different way of saying what I've heard, and I've been happy to hear it all through the day, is water pricing, water rates, water expenditures. It's a huge indicator. You know, it's in some ways an indicator of health, you know, because the rates are high enough to generate revenue, but there's a lot of aspects of water rates that make me worry. And I'll give some examples of those in a few minutes, but those are, you know, you can grade me later, Michelle, about those. There's things that we've seen in our work beyond just what you choose for indicators, and this is sort of just, you know, I want to throw out some ideas for when you are going down the path. we find, more indicators are better than fewer to a point. I don't know if it's 13, or 15, but it's not 3, it's not one magic number. So, when I'm wearing my analyst hat, I will sit down with 5, 10 things and try to balance them out. More years than 1 year is better. Trends are really important, whether it's 3 years or 5 years. So, I think any of these indicators we've been discussing can look bad for a year or two. So, trend analysis is important. There's always exceptional circumstances. So I think people sometimes don't want to provide information because the folks that they're providing information, if they have a process where you cross the line once, there's going to be something terrible that happens, and there's no ability to kind of explain, well, this is why we, had this situation. So, you just be aware of that. On the statistical side, I do like evidence-based indicators. The best you can do is to get a causal relationship, but at least know where your indicator stands from just a raw standpoint. In other words, if you throw out an indicator of X% per, X% of income spent on water, have a good idea how your universe of utilities fits into that. And here's just one example below where this was something we were looking at in North Carolina. So you can kind of start with, when we put our threshold somewhere, you can know how many people are going to pass the threshold. Because I have seen people put indicators in which lose their importance because half the population that they're trying to crosses the indicator. So I'm just a big fan of scatter plots for a variety of reasons. And then the two things about kind of what just data experience is, I like the matrix form that you presented where you're looking at multiple indicators and you got gut feelings. I've seen a lot of people get tempted to take 13 indicators, do a weighting system, and come up with one special number. In our experience, consolidating that, and I'm an engineer and a quantitative guy, I can see the value of putting into an index or a score. It's just I've seen some problems with that, and you can mathematically poke the indicators and get radically different you add 3 more indicators and suddenly your whole way of assessing a population changes. So again, this is something I tell my students is don't come back to me with the magic number. And then all data, as much as I'm a data guy, we have found so many problems with the data that we've used over the years, and we work with a lot of states that spend some time with the data quality before you get up in front of public and saying X, the world is like this, because there's a lot of dirty data out there. So I wanted to share with you, I think I have a few more minutes, share with you just some experience, some war stories, and some things that we've been seeing. One of the things that we do is we work with a number of states across the country on variations of financial benchmarking systems. And these are just some of the states. We've even added some more states since we did this map. But in each of these states, we collect some information, we get information provided to us, and we create data systems. And I just want to show you a little bit from that. We work with Arizona. We've been working with them with a number of years. And this is our most common model for our kind of a benchmarking system. What we do is take a lot of data, put it into a web-based portal that has simple dials and kind of conveys fairly basic information. The goal, I should add, for most of these assessment tools are to help communities rather than assess it, working with the state. It's a great tool because we work in partnerships with states. They tend to fund our work. But at the end of the day, I'm more excited when a city manager or a water utility director sends me an email saying, I've been trying to get my board to raise rates for 10 years and I couldn't do it. I showed this comparative benchmarking system to them and I showed them how we were low on one of these finance indicators, and that was enough to push it. And I do get those emails, which is really, really nice. So that's the goal of this. This is an example of a utility that I think is in pretty good shape. This is Flagstaff pulled up. A lot of the indicators indicators you recognize. We've been talking about them today, but the first one in that left top corner is just how much they pay for water. You'll see we do a lot with color coding. We like to send the message that there's a big range of acceptable prices. Don't worry if you're a little higher or a little lower than the median. But we also like to send a message that if you are in the real low end, that might not be a good thing. And if you're in the really high end, it might not be a good thing. So these are kind of sort of the simplified messages we send. The one on the right is more of a water conservation economic signal, because that's been important in Arizona. The one on the left is one that is really important to us, and that's the really basic metric of how much money you have coming in versus how much money you have going out. And we collect audit data and we present that. And in this particular case, I would say that Flagstaff probably needs to raise their rates a little bit, that they're covering their operating expenses, but they're not covering much for depreciation. So that would be a little bit of a warning sign to me. And then the one on the right, we've talked a lot about. It's one affordability metric. We're in the process of changing the way we think about affordability metrics. So certainly this is not the only metric. And if you touch that little arrow on the bottom or that little question mark, you get this big disclaimer that's saying, beware of using just this indicator. But it's it's data that we have, so we show that. I will say that all of our dashboards, or a lot of our dashboards, you can vary how much water you're comparing. So you can see that little toggle switch at the top. So if you're concerned about what the senior citizens that use 2,000 gallons a month, how they score on this indicator, you can adjust. And that's only possible the way we collect the pricing data and the way we put it into a modeling system that we've created. So this is an example of a failure. And I would say all of us have our job cut out for us, because yes, there are places that there are failures out there. Yes, there are water violations. But in the world of kind of data-driven, evidence-based kind of challenges, by and large, the water wastewater industry has done pretty well. So I know we have a lot of problems in a lot of communities we work with, but like you think about the ratings agencies, and they're like the biggest water indicator business out there. They have very few examples of people that have defaulted on their loans. So all of the manuals and the guidebooks and everything they're presenting as the way to assess water viability is based on common sense or gut. We have very little. In the finance world, we have just very little. Okay, these 5 utilities failed, or these, better yet, these 300 utilities failed. Let's look at what financial indicators drove them. So anyway, so when I hate to say it, I'm sadistic. When I see an example like this, I'm like, okay, there actually is a failure that I can study. So this was a community we were working with in North Carolina. They were going to run out of money. And it was a mess. To give you some input on what their indicators look like, this is another platform that we have with more detailed financial indicators, and you can see how bad this community looked before. There's indicators on days cash on hand, which is an important financial indicator. So again, you can kind of see when you look, even just looking at the dials, and you don't have to be a finance expert to know if you're collecting significant less money than your expenditures, you're probably going to hit a wall. So anyway, so this is just an interesting example of when we can actually say, okay, yeah, there was a problem, and this is what led up to it. So I guess I'll just end. I'll end with just a little bit of a show and tell. A lot of our tools are. People are concerned about comparisons, so we try to work hard so that you're not comparing Sacramento to Porterville, or I don't have my California geography, but you fill out the communities, because that's a big problem. A lot of times the small communities won't raise their rates because there's a statewide rate survey that shows what the average rate is in the state, and they want to be below it. Well, that's terrible, because you're never going to get some of the small systems to compete with some of the large. So most of our tools we've gone to a lot of trouble of creating these peer groups so that you can compare to. So, and then we have some other checkup tools that we've used. Again, ideally for us, people might use our dashboards to identify that there's a problem, but it's not enough resolution to really make corrective measures. So we have a financial health checkup tool that we have. And this is an affordability. We talked a lot about affordability. This is an affordability assessment tool that allows you to calculate. Probably with some work, we could get to. I think you could calculate some of both of your indicators using this tool, and it also gives you ability to take census data. All of this stuff requires good pricing data. So I will say, in my experience with California and most states, that tends to be the weak link of having pretty accurate pricing data. There are some states that we work in where a utility commission has rate structures and rate surveys. But in most places, it's like California, where there's a number of different surveys out there. But when you get into the data, they're not quite good enough to calculate some of these metrics really, I think, with a lot of confidence. So I think that's all I have now. I can take questions or comments.
I appreciated your point about dirty data, because I think I'm a very scientific-minded person too, and I love looking at statistics, but we do have to remember that sometimes the data is not totally accurate, especially if we're looking at a system who's completing an electronic annual report, and it's the clergy person from the church that's completing this. They may or may not be answering, maybe dishonestly, or maybe they just are ignorant about what they're answering on the questionnaire. So that's something I think is important to.
Yeah, we have dabbled in that data, and there's some dirt in that data.
As a former LPA person, I've seen some come across that are like, oh, and you don't always have time to do it for them or to correct it, and it's complete. So. Yeah.
Well, I challenge all my students to this. Like, a few years ago, I came in, I was so excited in my office. And it's like, why are you excited? And I was sent an American Community survey, for the census. I was one of the people that was actually being, and so I brought in the paper form. Have any of you filled that out recently? I challenge you to get that form and see the way that they answer the questions. And I could not answer some of the questions for the data that I use for my analysis. So, I challenge everybody to look at the way the data is collected. Sometimes, but by the time it gets to us, it's said like, oh yeah, this is X data. But when you find the question that they asked, they either were asking for maybe X, but could be Y, but could be A, depending on you interpreted it. So yeah, there's a lot of problems out there.
There's some, of the personality things that come out too. Like there's a comment section at the bottom of each page for the EAR, and one person had put in everyone, I don't know why I have to do this. I'm in every single comment. So it's like, well, how accurate is the information that he's reporting?
Your one slide. One of the things that I think is interesting about this, the slide that you have with the different water rates and the 4 dashboard.
Oh, yeah.
Go for that indicator, or that toggle at the bottom.
Yeah, you can't see this, and I didn't go all over it, but this again is our role for a tool for an actual utility director to use. We work with some communities that even basic Excel is challenging. So we've put their number of customers into our models, and if you can see on that very bottom, you can simulate a rate increase. And I wish it's live. You could do it, because as soon as you do it, all these warnings pop up. Like, this is not a rate survey. We don't. But it does let you see pretty quickly. Whoa, even if we double our rates, we're still going to be in the red. And the first thing I do when somebody calls me in my office, and because I'm on call, part of my job is really on call for North Carolina communities, is I pull our dashboard up, and they can hear me sigh when they tell me, and they say who they are, and because I already know it's going to take more than a conference call with me to fix your situation, because I've like looked at some of their numbers and, played around with the dial. So
yeah, I think that's. Are there any other questions? No. Okay, thank you. So last but definitely not least, although I seem to have lost my introduction sheet here, Greg Pierce is the Associate Director of Research with the UCLA Luskin Center for Innovation. He is also an adjunct assistant professor at the Department of Urban Planning at UCLA. He engages in planning and policy research for disadvantaged communities in 3 areas of drinking water, wastewater, and green infrastructure. Please welcome Greg Pierce. Thank you.
Thanks, everyone. I have the challenge and opportunity to interest you in an assessment of financial metrics as the last speaker of the day on a Friday. So, but I'm hoping basically to really build on what the other 3 speakers have touched on and try to give you a sense of particularly the financial metrics, but also a little bit of the technical and managerial metrics that we've been able to discover through a long searching process for small water systems in California, and then motivate how we could relate those back to the sort of human right to water outcomes or indicators that both Carolina and Laura have spoken to. So first, I'm not going to spend a ton of time on this, but I also came up with a list of 5 indicators of unsustainable systems. And I really focused on what we can measure in California, and this would be, I think it would be actually at least the first 3 would be my top 3 indicators of sort of unsustainable or vulnerable systems, in that first, a system that fails to deliver high quality drinking water, doesn't comply with the Safe Drinking Water Act, would be the first indicator I would look at, fairly obvious. The second would be severe source reliability or accessibility issues, relying on a single source, especially relying on a single water source and not having connections to another system. And then the third would be the third indicator of the human right to water affordability, having really high rates, some multiple of the state average. I put in 1.5 times here, but I'm not married to that number. And then beyond that, I think you get into more system level indicators that haven't yet been fully tested and related to human right to water outcomes, but which we think are important, and I'll really focus on today. The one I mentioned here is low operating ratio, basically that you're not bringing in as much revenue as you're spending, which is unsustainable in the long term. And then the final one I threw in was just really high consumption or production that doesn't wind up being consumption through leaks. But the assumption of really what I'm focusing on here today, and I think people have, different people have mentioned it, but I want to make it explicit, is that lack of system level technical, managerial, and financial capacity, or TMF as it's abbreviated here, in the long term is going to result in one or more of the following at the customer level, basically deficiencies again in the 3 human right to water outcomes. Doesn't mean that's going to result in all, and it doesn't mean it's going to result immediately. But over the long term, if you are not maintaining your system, it's going to result in unaffordable rates, water quality violations, or unreliable supply. That's the focus, I think, of TMF, or the implicit assumption of TMF. And what I'm saying here today is if we can collect some new TMF data, particularly in a public and sort of transparent way, we can actually test those assumptions, figure out which indicators work best among a variety that people have mentioned today, and then try to actually predict, system failure or failure to deliver the human right to water among these systems. How well we can predict, I certainly don't know yet, but we can test and see in a data-driven fashion. I'm focusing here on the F in TMF, or on financial capacity metrics at the system level, for 2 related reasons. Basically, that it's much more difficult to collect in the way that we've been trying to look at from publicly available sources, either the technical or managerial metrics that a lot of people have mentioned. And also there's less, there's not really agreement on any of these 3 sort of metrics of TMF, but there's less agreement on the T and the M than there is on the F. There are some indicators, most of which Jeff already mentioned, that are out there that people use to track financial capacity for systems. The challenge for us is that there is no known database or really studies on TMF in a large set of small systems that I'm aware of in California. And what we're trying to do here is basically give a scoping of what a database could look like with the metrics that are out there. And again, the goal is that we aim to assess, relate, not just collect financial metrics at the system level and look at them and compare them and stop there, but actually relate them back again to the 3 human right to water outcomes, relate financial capacity back to water quality violations, relate financial capacity at the system level to affordability at the household level, the customer level, relate financial capacity to supply shortages or lack of accessible water at the household level, and also relate TMF financial capacity in particular to inform and to evaluate the effectiveness of investments that are largely made through the Drinking Water State Revolving Fund and through other bond measures. In terms of what the financial capacity metrics, what people agree on in terms of financial capacity metrics, again, I would say there's not consensus, but there are a number of different metrics that are commonly put out there by different reputable entities, including the State Water Board, around what systems should be monitoring and tracking for financial capacity. So the State Water Board has a TMF form that it gives to each system that applies for state result, SRF funding, I'll say. There are some manuals from the American Water Works Association on financial capacity, although they largely focus on larger water utilities and capital financing. So they're not so relevant necessarily to small systems. And then there are some international utility benchmarking efforts and a few scholarly assessments that inform, again, the metrics that I'm going to talk about that I think we can measure in a few minutes. Again, the reason we're doing this is we're at least not aware of sort of any database of even a single financial capacity metric, unless you count retail rates as a financial capacity metric, but I wouldn't. For any large set of systems or any sizable number of systems in California. There isn't a historical database, sort of the financial capacity metrics for the systems that received SRF funding. There's no current ask, although it sounds like there may be an ask through sanitary surveys by the Water Board. There's no current ask through the electronic annual reporting system for financial capacity metrics from the Water Board. It does sound, again, there's a pilot survey out there for 10 small systems, and it sounds like maybe there'll be more data collected through the sanitary survey process. But right now, there's nothing out there, if you wanted, as far as I'm aware, that if you wanted to go and look at, say, a financial capacity metric for even 50 systems, that you could easily go to. The only other, and I think a few people have mentioned other states that have either are already collecting TMF data or have some sort of TMF assessment for a larger set of systems. I'm not aware. I looked for Washington, Idaho. I didn't see any publicly available data. The only publicly available database or sort of metrics I could see for other states were actually through Jeff's or through the Environmental Finance Center's dashboards. So that brings me to what can we actually do in California to collect financial capacity data. Honestly, we spent a year trying to find a single financial capacity metric for small systems in California with no success whatsoever. And then we stumbled upon 3 different sources for financial metrics for 3 different types of 3 different types of systems, many of which are small. But this financial reporting data for these different types of small systems is not coming from the Water Board or coming from really the water direction at all. It's coming from other types of mandatory reporting these systems have to do given their governance. So for mutual water corporations, there appears to be audited annual financial reports because these corporations or their mutual water corporations are actually nonprofits. They have to file I-990s, and there's 5 years of records for around 300 mutual water systems. Somewhat similarly, there's financial metrics in spreadsheet form rather than sort of PDF form. And there's fewer of them, fewer metrics, but for around 400 drinking water special districts that are accessible from the state controller's office. And then there's data, very detailed financial data on the 100 or so, 94, I guess exactly, Class B through D investor-owned utilities, so the smaller investor-owned utilities. There's also data for the larger investor-owned utilities, but of interest here is for the smaller investor-owned utilities through annual reports to the CPUC. And again, each of these data sources does have the multi-year data that Jeff and Laura, I think, were referring to as being more robust rather than looking at one-year data. That only covers, I guess I should say, this is about 800 systems roughly. And I'm sure we've looked at the data quality for these. We haven't fully analyzed, we haven't begun analyzing the data or relating it to human right to water outcomes, but we looked at the data enough to see that it looks fairly decent quality. I'm sure we'll eliminate some of the systems over time or some of the data over time that looks dirty, as Jeff said. But this only covers around 800 systems. There's 7,000 public water systems, but I think more relevant here, 3,000 community water systems. So there's at least 2,000 other systems that we might be interested in. I think we can safely eliminate, if we're talking about small water systems, we can eliminate the 400 that file urban water management plans and probably some others. But there's still at least 1,000 or 1,500 systems out there that we'd be interested in. Other potential data sources for small systems on financial capacity metrics, I think we could begin to compile the SRF data, the financial capacity metrics in the SRF data from their current paper and PDF forms into a database. Another large swath which would add some systems, although there'd be some overlap with the previous list. Another large swath of small systems is mobile home park systems, which we could potentially, through relationships we have with Housing Community Development Department, survey for financial capacity because these are mobile home parks that are regulated by HCD and run their own water systems. We're not aware of, though, any other centralized source for financial capacity metrics for other types of small private systems, other systems I haven't named because there's a lot of governance types, or for small county and city systems that are embedded in sort of larger public, in their larger public agency finances. You can get some data, I know, for some municipal systems, some county systems, but it's much more irregular how it's reported. What can we actually measure? And I'm not going to go through each of these metrics in detail, but for each of the first three categories of systems that I mentioned, mutual water corporations, special districts, and small investor-owned utilities, we can measure each of these metrics, which sort of Jeff showed pretty quickly, and I think Laura referred to a few, but that are coming from the literature and coming from existing TMF assessments. We can definitely measure the operating ratio, which is sort of comparing ongoing or annual expenditures to revenues. We can obviously, if we have that, we can measure just basic revenues, which some studies have shown called fiscal capacity and actually related back to violations. We can measure fiscal slack, or sort of the longer term assets versus liabilities balance, as well as outstanding debt and debt to equity, which is particularly relevant for capital financing. And then we could layer onto that for really any system in California, a measure of these economic capacity, as some people would say, either median home values or bracketed income. And then, at least for the mutual water companies and the investor-owned utilities, we could actually add a bunch more metrics that people are interested in, including factoring in depreciation into the operating ratio, liquidity measures, or what some people have referred to as sort of available cash on hand, as well as other measures of interest, at least from the international level, such as the ratio of staff to customers or the ratio of spending on capital to labor, as well as a number of other metrics. And then finally, I just wanted to mention that there are some other T&M metrics. I mean, some have been covered. I think Carolina mentioned a few, and a few were mentioned this morning. But there are some metrics that could be collected from annual reports or periodic sanitary surveys that are not, they're publicly available, but in my experience, only available upon request from counties, so they're not so easy to gather, but they are available if you ask, including measures of sort of the quantity, value, fiscal value, and quality of capital assets, basically infrastructure, the presence and level of training of a certified operator. I'm not sure about the presence of a capital improvement plan, but I think that data is out there somewhere as well. But that's actually my entire presentation. I wanted to run through it really quickly so we could have more time for panel discussion. But again, the goal here is not just to collect financial capacity metrics for their own sake, but to collect them, to assess their quality, to do so primarily from public data, and to build a database, begin to compare them, and then relate them back to the human right to water outcomes based on past performance, and then hopefully actually use the relationships that we established to try to at least assess or predict at some level the propensity of a particular system with particular characteristics to fail in the future and to intervene before that happens. So with that, I'm going to turn it back over to Michelle, but thank you for listening to my financial capacity presentation on a Friday afternoon.
Thank you, Greg. So we will take questions from the room, and then Wendy, if you'll also remind me to get questions off the internet. Thank you. Any questions? It's almost coffee time. No? No? Oh, there we are in the back. It always takes a minute.
Well, this wasn't directly related to Greg's presentation, but since there's no question.
Go for it.
So I think that I'm just trying to conceptualize the affordability ratio proposed by Laura's presentation. So is the point of considering the percentage of a household's discretionary income to assign an affordability rate that's equitable across, say, a disadvantaged household in San Francisco versus a disadvantaged household in a rural area? And would this ratio consider other economic expenditures that, you know, rural versus big city households have? Like, for example, a rural household might have higher water rates and other household expenses that maybe a household in the city wouldn't have, such as food, because rural areas are considered food deserts, and just other expenditures like that. Would it also consider that?
Yeah, I mean, I think that what we were trying to do was to come up with some way of thinking about how much is reasonable to spend on water that is not likely to start to compromise your ability to also meet the necessities of food and shelter and healthcare, childcare, taxes. I think those are what we put in there. So the tough thing about this, as Carolina alluded to, is that you don't know really what every household's essential expenditures are. There's massive variation. I have 2 kids that are not school age, and I pay an enormous amount on childcare. And you're never going to know exactly what every household's essential expenses are, and so it's tough. So you're never going to get to some perfect sense of whether or not somebody can or can't afford their water without having them share their monthly budget and income with you, which you're not going to do, right? So what our compromise was very similar to Carolina, was, well, we can't necessarily say how much is affordable for water across the board with some extremely high level of precision, but let's try to adjust a little bit for the difference of cost of living county by county in the state. So we know that the cost of housing tends to be higher in some counties than other. Let's adjust for that. We know that that's the main thing, honestly, housing. The housing costs vary enormously county by county. Let's adjust for that a little bit, and so that we can acknowledge the fact that a certain income isn't the same in LA or San Francisco as it is in Fresno or Tulare. And so that's the idea, is basically to think, people can't afford to spend an enormous amount of their income every month on water and still make it, right? So when you're talking about, I think somebody was talking about one system where people spend 13% of their income on water, the median household spending 13% every month on their water. I mean, maybe if that is an extraordinarily wealthy area, but wealthy households never spend 13% on their water. We're presumably talking about a low-income area with a water system that probably has really high treatment costs, and people are paying more than 1/10 of their income every month for water, and presumably that means that they have almost nothing left over for that sudden emergency that comes up, for that, all those little things that you can't predict every month. So that's what we were trying to do. That was kind of a long answer. I'm happy to talk to you more about the nitty-gritty, and the formula is right there in the report if you want to look at it.
Thank you, Laura. Caitlin, did you got someone back there with a question? Let's go to Caitlin and Cindy, and then we'll.
Is this an okay time for general comments?
Sure.
Okay.
Yeah.
So Cindy Tuck with the Association of California Water Agencies, and we really appreciate the workshop today and all the guests who came and made presentations. This has been a lot of information to soak in on a Friday afternoon. Some general comments about the needs assessment. Just at the highest level, we think it needs to be solutions-oriented so that this needs assessment can be taken and that can help guide where we need to go to have everyone having safe drinking water. We think the state should focus on persistent violations, and that the needs assessment should prioritize what the needs are. And there's not necessarily today, but at some point there needs to be discussion about how to prioritize, maybe looking at what are the greatest health risks first and having that as the highest priority, for example. There needs to be talk about what information is needed for the needs assessment. We had a group working on this and just started talking about things like, the source of the water, the contaminants, the location, opportunity for consolidation, TMF, and other things. But there seems to me needs to be a lot of discussion about how to make this work to maximize the money that the state has allocated for this purpose. So that really brings me to the question is, we would suggest that there be, and I don't know what you guys are thinking, but there be a next process step where we could have either a stakeholder meeting or a workshop where State Board staff, Division of Drinking Water talks about what you're thinking, maybe gets that out in advance, and then there could be a discussion so that you could have input to inform how the needs assessment would actually be conducted.
Okay, thank you. I would say that there will be, there's the 3 workshops, and the final workshop is, I think, kind of that solutions piece you're speaking to. I don't know if, Darren, you look like you want to jump in. But, some of it is the costing and the methodology and things like that. I'm going to let Darren jump in. But I would definitely agree with that and say that we're looking towards that.
What is the methodology? What information should be considered? All of that, I think stakeholders from different sectors would be interested in what the thinking is.
Yeah, we'll definitely do that. And I'll start now. The needs assessment, in my mind, is not directly related to communities in consistent violation. We are going beyond that. This is really about trying to find the ones that have not done any violation yet, but will. So, I appreciate your comment and understanding there, but I wanted to, because that's kind of such a departure from where we're already starting, I want to be clear that we've separated that out. We will have a needs part that will measure systems that are in violation, and those are the easy numbers we have. They're on the Human Right to Water webpage now. That what we're really talking about today is trying to predict a need assessed with who isn't there yet, because I don't want to get there. I should never, the idealized world of which I know I'll never achieve, right, is that my Human Right to Water page is all blue dots and it never has a red one. That would be the target we should shoot for. So we're really stretching. We're trying to go beyond that. So, and it's a good point. We will definitely try to maybe have a quick workshop where we lay out, okay, here we've come up with a draft plan, and please give us comments on that before we proceed. So.
That would be fantastic.
Yep.
Okay. Hey, back there. Hi. Are we not turned on?
Thank you. Katie Porter with the California Urban Water Agencies. So two-part comment. One is I'm very encouraged to hear a lot of what was presented today, that there's so many entities in our community working towards a similar goal. And a little bit along the lines of what Cindy asked, I, as KUA, is also continuing to do our independent analysis on how to work towards solutions. What mechanisms do we have to share that information with the state boards as you do your needs assessment? Hopefully, some of these independent analyses can also be feeding synergistically and not duplicating effort. So that's one part is what are those feedback mechanisms? The second was specifically for Greg. I feel very echoey. For Greg, I appreciated you listing a number of data sources for the TMF. I was curious about whether you've actually started to collect some of that data. It sounded like you had started to get some data from those sources, but I wasn't clear how much of it you had collected, if you're planning to do something with that, and if so, on what time frame and in what format. Like what would you see that informing?
Right. So I think the answer to your questions is we've begun collecting it. It's all publicly available. I mean, any of you could go to the website, the various websites. It's not very easy to find, but it's all publicly available, and you can go and download. I mean, some of it's for mutual, to get specific, for mutual water corporations and the investor-owned utilities. There's an annual report for each system for each year, and then there's metrics within that PDF that you'd have to pull out and put into a database. The special district data is for all special districts in California, so you have to first find the water special districts within that Excel spreadsheet, and then the TMF metrics are basically columns. And so we're aiming to take all three of those sources and put them in a single database. I mean, for those metrics that are common across the three sources, and then check the quality of the data further and the consistency of those metrics across those three different types of systems. That's where we'll start. What the exact timeline is, I'm not sure of when we'll be able to. I mean, I think we'll start soon, but we only identified those sources and were able to check the basic quality of them within the last 2 months, and we wanted to sort of put this information out there and frankly hear from other people who know of other sources of data or who have worked with this data before we actually began the compilation and analysis. But again, the goal is not just to come up with a database of TMF metrics, but to test the relationship of those TMF, or these really financial metrics at the system level, back to the human right to water outcomes, again, controlling for the other factors that we already know are correlated to those human right to water outcomes. And then you see if we can use that information to predict, as Darren was saying, or inform where system failures might take next or where investment should be made prospectively. But if we get other sources of data, we want to find all the sources of data first before we start analysis. We want to get the biggest data set possible.
Thank you, Katie. Darren, do you want to take that? Or should I take it?
I wasn't listening.
I guess I'll take it. So, I appreciate your input, and we will think about the feedback mechanism, and perhaps we can address it either next week at the next workshop, or we can address it individually with your two organizations. So, does that help? I mean, because we're certainly open to having more conversations with multiple organizations. This isn't the one-time availability. I mean, we've had earlier meetings with different groups, and so we're open to having more.
Which is great. And I think what I heard is there's two separate issues. One is having a meeting where different stakeholders can have input into how the needs assessment would be done before the staff makes that decision, inform that. But then also have the ability, if a group like HUA is doing a study, or whichever group is doing related studies, that they can make sure they get that information when they have it to you, which I assume you're always welcoming information.
Yes, no, and we're wanting not to duplicate efforts. I mean, that's part of the purpose of today's workshop is, you know, there's a lot of wonderful stuff already being done. And in order to spend the money efficiently and thoughtfully, we want to make sure that we're gathering what's already been done. So
that's great.
Okay, so do we have any questions online, Wendy? Okay, well, why don't we take, well, never mind, Marina has one. And then we'll take a break and everybody can go get coffee and roll up their sleeves for like when this next hour where we have sort of a facilitated discussion on how to deal with this.
This might be a better comment for the facilitated discussion, but as we're transitioning from today's workshop to next week's workshop on public water systems, we might start thinking about how schools fit into both of these frameworks, especially in the case of schools where they are private water well owners, but because they are a school, they serve as a public water system, and how these needs affect them differently, because in a lot of cases we have janitors that become the operators of the systems, and if they get treatment, you know, they're the treatment operators as well. And so I think that that we need to look at schools in, you know, a prioritized way that might be different from disadvantaged communities, just because of the unique situation that they're in, especially because they're supposed to be providing education, and water is not their specialty.
I absolutely agree. Thank you. Yeah, I mean, that's why they are on our human right to water list.
Michelle?
Yes, I hear my name.
Michelle? There is one question that I told him I would wait until the end. And it's actually a question for Holly.
You know, at the end,
I think I already addressed this question. Forget it.
Okay, one more question.
I guess this is more of a comment. I'm Tim Worley with the California Nevada section of AWWA.
Hello.
So a lot of the premise of the needs assessment is the human right to water and the state policy in that, you know, in achieving that. And that's one thread, or kind of the premise of why this needs assessment is so important. But another thread that's a little bit different, kind of a different nuance on the ultimately what is the problem we're trying to solve has to do with sustainable water systems. Mm-hmm. And those aren't necessarily the same, because if there's a large subsidy for achieving the human right to water, there may not be, you might subsidize unsustainable water systems. So I think that's an important kind of threshold question that we need to keep in mind as we think about what is the problem we're really trying to solve.
Yeah, no, I absolutely agree. I mean, we don't want to put Band-Aids on things that are fundamentally unsustainable. Do you want to?
Yeah. So Tim, I think that's important for the cost when we're getting into determining cost, because exactly, we've said all along, we don't want to document, you know, a 50 connection system that's never going to make it, and then figure out how the rest of us can make that happen, especially if they're right next door to a big system that I should force them to consolidate, and that's the cheaper way. So we do, that very thought is important, and we want to make sure that we are as wise as we can be and efficient as we can be whenever we come up with the funding need associated with that. And that'll be the heart at the question in the, was it May? May.
Sure, and then I promise coffee, okay.
Oh, sorry. Well, or a break. Tim, I appreciate that point, Tim, right? I appreciate that point. I think that a group of us in here put in a comment letter on a different but sort of related activity at the Water Board on developing low-income water rate assistance. And one of the major themes in that letter, which I collaborated on with RCAC and Leadership Council and Community Water Center, was that the first step is look at what you can do to make the system sustainable. And only if you don't see anything in your toolbox to make that happen do you start talking about subsidies. You don't think about these, you don't go to subsidies necessarily as your first step, right? You want to get the system working well and serving its customers well and equitably and fairly, and you use everything you can first up for that. And I think it's a different context, but I think that translates over a little bit into what I've heard like Cindy saying and Katie saying about thinking about solutions, that there might be a stepwise approach to solutions that we could be thinking about with these sustainable water, or getting all the systems to a point where they are sustainable, ideally, as your first priority.
Okay, so we will come back maybe, I'm going to say 3 so that we can start maybe a few minutes after 3. So we will see you back here at 3. You take a break, and we'll have the full panel up here. Presenters to come up. Hello. Could I get everyone to start taking a seat and the presenters to find their way to the front? This is such valuable time. Everybody wants to, yes, everybody wants to have a chance to connect with each other. So if I could get the presenters down here, all of you, that would be great. Thank you.
We can add some more chairs if we need to. Okay. So folks, if you can make your way to the front if you were a presenter, and make your way to your seat if you're part of our audience. Friday afternoon, we've lost a lot of folks. My name is Gita Kapai. I'm the Director of Public Participation. I'm going to facilitate this final part of our conversation. We have our panelists up here. We've had a long day full of lots of really good presentations. I heard some common themes. I'd like to try and get your thoughts on what some of the commonalities were, what we heard today, and get some of the top ones up here. And then if we've missed something, let's add those. So I've got microphones that will run, and we'll capture these.
Well, in the age of the internet, I think it might be helpful if the people noted on the workshop agenda, if an email address could be included with the speaker's name.
Thank you. Noted, sir.
Thank you.
Yeah, Bob Brownwood, Division of Drinking Water, and thank you for this, Michelle, and everybody who showed up. It's really good. Something we've been looking at for many years. A few things came to my mind and crossed my mind. That one of them, when you talk about the needs assessment, and it'd be really neat. And I'm hoping Michelle's already has done this, but collaborate with each of you on what exactly you're looking at the needs assessments. And of course, that is the first step, is assessing a need, and then how do we solve that and get to that. And then another thing that came up is, we talk about affordability and willingness to pay. I mean, I know those are really two distinct terms, and it's part of what we have to solve as we move forward with TMF and regulation development and what have you. And, it's, as somebody else phrased it, if I had $10 extra in my pocket each month to spend, do I want it to go toward reducing my risk of getting cancer from drinking water by 1 in a million? Or do I want to play the lottery and try and win $3 billion and take it easy? And those are really tough questions. It's like, how do you answer those questions? And I'm just going to let that out there. How do you answer those questions?
My master's thesis was on how to run willingness to pay surveys. So for at least 2 years, a long time ago, I thought, yeah. So good end of the day question for me. My master's thesis was on how to run willingness to pay surveys, but it was about 25 years ago. So I'm trying to remember how to do it. But it is. I'm just really thrilled to hear the term ability to pay, willingness to pay, and affordability, because they are different concepts, and I think it has to get integrated into all the work we do. It is awfully tough to ask the public, just the mechanics of how you carry out an economic survey. If you had money, would you spend it on this or that? And there are people that focus on how to run those surveys. So if that really is your question, I can give you some economists that have tried different ways of asking questions. There's a lot of ways of inferring the answer by seeing what people spend money on. But it's a tricky one, but just to be aware of the difference between willingness to pay, ability to pay, and affordability is really important. And I think just in the dialogue we have, it would be probably help us to sometimes be talking about, are we talking about willingness to pay or ability to pay?
I think part of the problem with that question is that water's been so undervalued for so long that people in the general public don't really have a good concept of what they should be paying for water or what their water costs. So part of the answer is going to be to educate people on what is your water cost, what are you getting for your money.
I think that's a really big point, and I always love to see the $1 a month for water in 1960. What would that be today? Us, and I think everyone would be surprised. It really has been kept up with inflation, water costs, and that's just an education thing.
I think this conversation kind of draws attention to one of the needs that we have to assess, which is how do you educate people in these communities about what they should and should not be doing. And I mean, if they want to maintain their own water system, what their responsibilities are, and figure out if they want to accept them, and how do you have that ongoing conversation.
And I'd just add, Mike Claiborne with Leadership Council. I work with disadvantaged communities in the San Joaquin Valley and the East Coachella Valley, a very hot area where water is hard to come by. I haven't seen in the work I've done a lot of unwillingness to pay for water, so I don't know if that's just part of the experience I've had because of where I work and who I work with. It's much more on the affordability, ability to pay side, and the fact that if you're making $430 a month, it's pretty hard to cover a water bill. So I just wanted to add that.
Really good question, really good point, Moises, with the Office of Public Participation. There's some communities that we've worked on in the Central Coast that have experienced hair loss and rash because of water contamination and are willing to pay but cannot afford to pay. They're willing to pay for safe and affordable drinking water, for safe water, because they've already experienced health effects. Now, can they afford it? They've made it very clear that they cannot. So it's a very good distinction that you're talking about. Those are two very separate things.
Jim Mon, I see you sitting in the back. Do you have any thoughts to share with us? Jim is in our Division of Financial Assistance.
I wish I had some profound thoughts. I found this very interesting. Just for the group to know where we struggle in California, and I think some of the speakers up there are aware of this, is with the 218 process and our funding ability where we can't fund to an individual household and we're funding to a water system. It makes it difficult when we're looking at these things at the different levels. I think it should be looked at, but that's where we struggle with the funding side. We can only fund a public water system, not an individual household who might not have the ability, as we're talking about, to be able to pay.
Thank you. We have a comment in the back there.
Just a thought on that is, I think that a lot of the service providers that as we're referred to today, such as self-help, and I don't want to speak for the others, but we might consider contacting service providers to be vehicles for that funding to households, because we are familiar with running programs that offer assistance to individual households and creating regulations and creating monitoring programs to make sure that those funds are used responsibly.
We lost you there, the last part. And I had a follow-up question on that too. So you're going to run another mic. Thank you.
Yeah, just using the monitoring programs to make sure that we're using those funds responsibly, and make sure that the people who need it are getting it. So that just might be another suggestion, is tapping into the service providers.
Thank you. Can I follow up with you though? I have a question because we've had some discussions at various times about the service providers, and do you guys have other programs, housing programs or utility programs of other nature where you guys do act as an agency that receives funding and then disperses that out? And if so, where and how do you do that?
Yeah, we have a lot of programs that we do. We do a lot of housing programs, a lot of rehab programs. We're working on doing the utility and gas. So we're just tapping into that now. And we also have a household water well program where we receive funding from SWRCB and federal sources, and we develop program to disperse those funds to individual households. So I'd love to follow up with you.
Yeah, thank you. Did any of the panelists have any thoughts on that? Just on how we manage to that's really loud, how we manage to disperse the funding in a better way. Have you seen other models in other states, Jeff, or other places that don't have some of the limitations that we might?
There's a rising movement for funding agencies to try to look at how to at least do both community assistance and household level assistance, but it's really tricky. Historically, particularly programs like the SRF, the State Revolving Fund, were designed to subsidize communities. The challenge is, and I think everybody knows this, is when you give $1 million subsidy to a community, then the people that use the most service get the most subsidy. So often you have this distorted situation where you're using state funds that are going to the biggest users in a community. So people are aware that there's a disconnect there. There's still always going to be a role for community level subsidies, but I think there are a few states that are trying to look at how they can make loans or grants and then it's all very subjective to state law, and you all have very interesting state laws here, but, can you make a requirement that will give you a lower interest rate if you agree as a utility level to fund a affordability program that is equal to your savings by us giving you the lower interest rate. So there are some clever ideas out there that are being floated. I actually worked with a few SRF programs to see if we could make it work. There's some similar, I don't know if Jim, you're familiar with this sponsorship model for non-point source. It would be designed like that. Maryland has experimented, or Delaware, has experimented a little bit with those types of programs, but they're tricky, and you get into a lot of both legal concerns and just frankly, it rubs people the wrong way sometimes giving funds directly to households. I would say the lead challenges that we've had in parts of the country have opened the door to this understanding that in the future, our funding assistance programs, whether they like it or not, may have to start going toward the household level, because lead is largely a household level problem that spills over to a utility level problem. But so you can see some of the states that have actually had to change their laws so that they can use their SRF funds or their other funds to target particular neighbors. And nobody's quite figured it out, because a lot of our programs were not designed with that in the mind, but certainly people are working on it.
Thank you. Okay, so shall we, any other comments, questions?
Well, I hate to put these people on the spot, but I think there's a few people in the audience who have actually thought a lot about how to funnel money through the State Water Board to households that are reliant on drinking water wells that do not deliver safe water. It's one of you guys. You all look half asleep, but.
So, no, I don't think we have solved that problem yet, because the biggest issue is you can't find a funding pot to use to even experiment. So I know that the Division of Drinking Water has provided some funding for the well program that Self-Help is running, but how do we determine how we provide assistance to domestic well owners, to septic users? If we want to hook them up to a public water system or public sewer system, that's one thing. But if we want to help them stay in place, that's something else. And then when you add on top of that, mitigating lead in homes, I don't think we've figured that out yet, or persuaded elected officials that it's a good thing.
Thank you.
I'm glad you started that, Jennifer, because I didn't know how to start that. But I will add, for domestic wells, just on the consolidation part, there's a new law that was passed last year that allows the State Water Board to extend service to domestic wells, which should really help. But one piece that I wanted to address from earlier today, there was a discussion about the need for consolidation and not propping up systems or domestic wells that should really be consolidated. I agree with that wholeheartedly, but also just wanted to point out that there are some systems and some domestic wells that aren't going to be consolidated. They're too far away from a system, or political needs, or whatever else are going to prevent those. So we talked about that a little bit in the hall with Laura and Greg afterwards. I just wanted to bring that up.
Thank you. Yeah, no, I think we talked about it a little bit separately as well. So thank you.
Ryan Ojakian, Regional Water Authority. I wanted to come back to a comment that Laura made before we broke, which is stepwise solutions. I've heard a lot about problems and some solutions, but I haven't heard a lot about connecting those things and really where the first step would be. That's my comment.
Yeah, thank you. You want a response? Yeah, do you want?
I'd love a response, but if we don't have one.
Do we have a panelist? I mean, I'm happy to speak to it. But so, I mean, to me, for today, it is to determine methodology and think about methodology for finding, to identify them all, because I think we have to identify them before we come up with solutions. Because at least in some of my consolidation work, what I've seen is, you know, if we're putting in the pipeline and we didn't know the state small was there on the way and we're on the wrong side of the street, then it's a whole new CEQA, it's a whole new everything to go across the street and pick them up. So I want to make sure that we identify them first and then seek solutions, because if we can map them and find them there, then I think that that's part of it.
So that's helpful to hear, but we have identified some of the problem. That's the Human Right to Water website.
Right.
And we don't know exactly the scope of how many people don't have access to clean, safe drinking water, but we know that a good portion can be found in that characterized portion.
Correct.
So, I mean, we're not talking about steps here, but it seems to me like that would be a good first step potentially to talk about how exactly we solve that problem.
And I think I think that's to Cindy's point as well about the prioritization. And I think certainly ones that have violations that we know of will be our first set of priorities. And to your point, I already have a spreadsheet internally that I have all of those listed, and I see how far they are from other things. And I'm working down it accordingly. But it is, in terms of this bigger needs assessment, I think that they'll be prioritized higher, but I also think we got to include everything, because I don't want to miss things and then have to come back and do it again. So was that enough, or?
It helps me understand your thought process.
Okay, thank you.
I'm going to go back to the previous point of how we get money out to the systems, because I've worked on a lot of grant-funded projects and under different contexts, so I have thoughts on that. So when you're doing it with a big utility, the big utility pays for the project and then the state pays them back. So the big utility is like, oh, whatever, I'm out $5 million for a few months, that's okay. But a small system doesn't have that kind of float. They can't write a check to the contractor for $500,000, the equipment provider for $500,000, and wait 6 months to get the check from the state. So in the UC Davis project we're working with to solve that problem, Davis is the one that's contracted with the state, and then they'll be the ones fronting the money to the small utilities to get the equipment on the ground, and they're the ones waiting for reimbursement. So to me, we need to get more maybe flexible or creative with how we can get the money to the small utilities that don't have the financial capacity to wait 6 months to get reimbursed. We would have to have some sort of mechanism where either the state can pay the contractor directly after a competitive bidding process that's fair, or it's run through some system, somebody that has the ability to wait that long for funding. So anyway, I think those are some really important considerations, and it has limited projects. It's limited the ability of the small utilities to apply for funding and then for them to actually make projects happen.
I would agree in a lot of respects. There are certainly some places where, and getting the large systems to want to do an application on behalf of a small system is also difficult.
So through the IRWM program, and that's about as far as I know, there is legislation now that's passed where project proponents can get half the money up front for a project, because we recognize that most of these small organizations just can't front all that money. There are a lot of strings attached, and I think it has to be a DAC project on less than $1 million. And they can only front the money up to 18 months, and then the rest of the money isn't fronted. And there's some effort now, and other people in the room probably know better than I do, to try to get all of the money fronted potentially, and maybe it would have to take place over time. But at least the IRWM side has recognized it and has tried to address it somewhat, but it's still an imperfect solution.
We had a comment back here.
Hi, Danielle Pullman from Placer County Environmental Health. Just kind of changing gears, I wanted to point out one of the things that really struck me today was the emphasis on TMF education to board members. Just working with small community water systems, they're very resistant, as we discussed today, to rate changes and having a rate study done. And I think this all just loops back to the board members and community not understanding the importance of TMF. And so I think a possible solution for that, especially at the county levels, would be for county regulators to really network with the board members and provide them information on all of the organizations and training that's available. I know just being here today, I've worked with RCAC and CRWA, but I found out, oh my gosh, there's all these other organizations that are providing funding, assistance. So I was wondering if potentially the water board can compile like a list of organizations, maybe by regions or something, and that way this information is available for county and state regulators so that, you know, we're the ones with our boots on the ground out with these water systems, and that way we can relay that information to them.
I think that's a great comment. And I'm sure Wendy's back there listening to that. I mean, we could do that in a lot of different ways. I mean, you know, whether it's a train the trainers kind of thing, or it's, you know, putting it on our website. I don't, you know, certainly there are a lot more people than the more I dive into it, there are so many people doing great work that we do want to, I mean, at some point we should start wrapping up and thinking about our final comments and how we wrap today up, but.
So I thought I would take the opportunity, Jeff knows I'm a big fan of his dashboards. In the audience, raise your hands. Who would like to see dashboards like that for small water systems in California so that the board members can have information at their fingertips and it helps get the community? Yeah. Close to majority. All right. Thank you.
Okay, so we'll take one more quick question, or you know, we can do as many, but go ahead.
Hi, my name is Adriana. I am a new water fellow with the Environmental Defense Fund, and I have a comment and a question. My first comment is when thinking about funding for low-income households in disadvantaged communities, given immigration status and the proposed rule for public charge, how would that affect immigrant communities in those areas? And then my second question, so I'm working on a project that's related to disadvantaged communities and water markets. And I'm interested to know if any of the disadvantaged communities that were part of your studies participated in water trading. And if so, what were the tools that allowed them to be part of this program? And if not, why? Thank you.
I'm going to put that out to the panel. Is Amanda back there? Amanda, do you want to speak to that in terms of Davis? Caitlin, can you run her a mic, please?
Yeah, sorry. We've had some interaction with EDF in some of those communities in the valley, but I don't have any personal knowledge that they've been involved in water trading.
Could you repeat the first question about undocumented status, or what was the question exactly?
Given the new public charge rule, which is still not a law, it's under review for comment. I was wondering if there are going to be any types of help for low-income households, how would that affect immigrant communities in those households, given the public charge rule that would not allow undocumented people to receive citizenship status if they were to go on that path, if they were to receive assistance from the state or federal level, which undocumented people can't really receive funding or any type of assistance from federal level. But that's just my question.
Feel free. If anybody wants to take that.
Right now, we don't really do, our CAC doesn't do a lot of individual household work. We do mostly water systems, and we don't differentiate from household to household and say, oh, that we're only going to provide assistance to these people because they're documented. We don't look at that at all.
On the second question, water trading for disadvantaged communities participating in water trading, the person I would suggest you talk to is Ann Thiebaud at Pacific Institute. Specifically what she has looked at a bit, and there's not a ton of it, is communities that send their treated wastewater to irrigation districts. That's I would say, the main avenue of, if you characterize that as water trading, that does happen among disadvantaged community water systems, and it can improve their financial standing. It can reduce costs or increase income.
Thank you. All right, I think we should probably start wrapping it up and just kind of getting, it is Friday after all, and start getting our ideas around sort of finalizing a couple of the themes of the day. I mean, I heard, let me get my notes. Chime in on this too. You know, I heard sort of the indicator-driven by research and taking the indicators that we got. I heard multiple indicators. I think Jeff said that, making sure that, you know, we had more indicators, and then that also goes back to the question of what's too many indicators, because we don't want to burden people either. You know, I think there are a lot of themes in the indicators that I saw, and these may or may not, as Laura, you know, you said, we need to go back and review those too, but single source, I calculated some time back, and it's very rough, but, you know, a very significant portion of our community water systems are single source. I'm not even going to throw the number out because I have it in my head, and it's very significant. And so single source, I heard, you know, your various indicators that you're already thinking about and getting public comment on, financial water rates. Does anybody want to kick some more in here that I?
Well, here's what I'll throw to the panel, and you all have to answer this question, but you only got to come up with one. So I guess what I took away in a lot of ways is that people were, because it's what we have to do, right? We're using data that's available. All right, so I've got $3 million. What's the one thing you want me to buy you that isn't of data that's available now that you think would change your assessment or how you've done something? Because I can pay for, you know, some new work that would generate some new piece of data. So have at it.
Yes. Why don't you, Darren, can you repeat it? Oh. Yeah, it's really what if we could do one thing that you can think of.
I mean, there's been great work done. You guys have done remarkable things, and I think, you know, obviously the work is related to what data is available that you could grab, that's out there, that someone else has collected, and pull those together and do it. But I'm sure in that there was like, God, if I could get this one piece of information that no one has, you know, and I could get a room full of students to put it together or hire a consultant to generate it, and it would make a difference. I mean, we always want more, right? But you really feel it was a difference. That would be an interesting question, because I felt like everybody gave presentations, and the work you've done is based on what is available. What's not available that would change your work?
Revenue and annual operating and maintenance expenses, right? Annual revenue and operating and maintenance expenses. If you could collect one thing, or three things maybe, I would do those.
We'll take that. That can be
Bacteriological compliance data. That's
Available.
one thing I've seen missing in, you know, whether systems are in compliance or out of compliance, since that's not readily available as a metric.
So you're saying on the Human Right to Water website, or just available somehow?
In some format, yeah, to include that in compliant or non-compliant.
Okay, thank you. Yes, Holly.
I could use more income data. Well, different kinds of income data in various ways, but the one I'm thinking of the most is there are a lot of small communities that we work with that are their own census designated places, and there aren't any income data. So I go to the census website and I start looking up the data, and they say, I don't know, not available, or they estimate MHI at 0, and obviously that's not the case. And with the mapping tool that we use for DACs, it seems sort of arbitrary whether they then designate that CDP as a DAC or not. But it also just doesn't give me any idea of what kind of community it is. So we need more complete income data from the census or somebody collecting that information.
Thank you. Carolina?
I have two that came to mind. I know we said one, but one is filling in the missing data on water costs for systems, as I mentioned earlier. And I just forgot the other one. I'll come back to it.
I mean, I'll echo both what Carolina just said and Laura said, but I'd also throw in something from way out in left field, but related to something that was brought up earlier, the potential or the ability of water systems to fight fires or their fire flow capacity, which supposedly fire insurance companies or risk assessment companies sell to fire insurance entities, but won't make publicly available. So,
yeah. Okay. Yeah, no, and that's a good point given where we've been. Jeff, do you have a thought? I mean, I know.
All I can think of is this is a weird Christmas wish list. Sitting on Santa's lap and saying, "What do you want? What do you want?" Most of my top toys were already picked, but we are using a lot with some metric on the amount of stuff that people are responsible for, and it can be it can be their book value off of financial, where you actually have what is the value of their assets and divide that by the customers. That's hard to get, or it could be if there are some of these service providers are providing like, oh, they have this many wells or this many line and pipe. I would like that.
Okay. All right, yeah, go.
I remembered my other one, which was just the background is we have the great fortune that now we have almost all community water systems mapped after many years of effort. And what I think is missing is state small boundaries in that same way.
Do I get one? Do I get a Christmas wish? I would agree with you, except I would have all of our transient, non-communities on there too, because I struggle with that from the partnership standpoint. So, Karen, do you have one?
I think my wish list.
And then we had a comment out there.
So it seems like the state, this is Cindy Tuck with Aqua, it seems like the state should be able to answer the question for the 261 systems on the list now. That, and that list gets a lot of reference and a lot of attention, of course, as it should. What would it take to solve the problem? So that means getting, and I don't know how far in detail the board staff has gone, but getting into the source of water, the contaminants, the level of contamination. Is consolidation the right solution? Is there a better solution? What's the TMF? And getting into that information for that list of systems. And if you haven't gone into that already, that takes time and resources to do that. So that would be an important activity we would suggest.
Okay, thank you. Yeah, so more emphasis on the cost estimating part of the existing ones. Is that what I'm hearing? With focus, when I say cost estimating, I mean to find the solution. Yeah, thank you. All right, so are we missing any other?
Well, I was just going to say, what point in time are you going to take that 261? Because I assume you haven't yet posted all the systems that are now out of compliance for TCP as of December 31st. And by the time this needs assessment is done, you'll have several hundred systems out of compliance with a new hex chrome standard. So I agree that we should do the bird in hand thing and understand the cost of solving those problems. But by the time we get through these problems, we'll have 150 more.
You have a comment back there. She's coming behind you.
Oh, that's fine. I just, maybe a question / observation. I think today was a very rich overview of critical work that's been done that paints pieces of a picture of how we think about systems at risk. And I was wondering if there's a plan to do any kind of meta-analysis that even pulls together today, like what does this tell us that we agree? What are the themes, the agreements, the truths that this research, if we integrate it, says, like, what's the picture and how do we bring it into focus? Because I think each of us are doing that individually, and there's some great minds here, but you each talked about your piece, and it'd be interesting to have some integration of that.
And I would agree with you, and I know internally for us, the point is after we get done with this, to come back and try and integrate that information. But I don't know, if I don't see a report or anything, but I should punt to Darren for that.
A day or a call or something of the panelists today to say, like, what's our meta-analysis if we were to kind of come up with a white paper that says, here's what we think our research says that informs us moving forward. I think that could be very valuable.
Thank you. That's a great comment. Okay, are there any other wish list items that we should have before we adjourn?
I do think we need to think a little carefully about what we're considering a system out of compliance, and put a couple more things into that before that 266 sort of becomes some magical number that we've forgotten how we even got there. I think a few of the things to think about are duration and recurrence of problems over a period of time. So that period of time that is expressed on the Human Right to Water portal right now, it just continues to grow. It had one start date, and the current date keeps moving, right? So the number of systems that are in that return to compliance category keeps growing. Right. So let's keep the denominator, the window of time constant, right? And think about recurring and persistent problems, and also think about getting other health problems that aren't on there, like the coliform, and then all the new MCLs that are going to get phased in soon. So I think there's a bunch of different places where we need to think about what that right way to look at out of compliance is before we sort of decide that we're done there.
Okay, thank you.
I'll just add really quickly one thing to Laura's point on what systems to consider, especially when we're looking at potential future problems, is secondary maximum contaminant level violations. That's information that we don't have. It would be really nice to have.
Thank you. We have a gentleman in the back there.
Just another $3 million wish. And I was thinking about, there's a lot, but I think one issue that we've had, and it's hard to get the data from customers and from our health organizations that provide services for our tribal or for members, is the health impacts and health-related issues that some of our customers or residents didn't understand that it might have been water-related, so they wouldn't call us. So a lot of that data, I think, coming from the clinics or coming from the hospitals or whatever, it's not existent. So in correlating that with possibly some drinking water issues, but that was one big thing.
Thank you. Let me make sure I understand that clearly. So are you saying when you're getting calls from the hospital?
No.
Because people are sick? Or
more of the data that's associated with illnesses at the clinics, and that acquiring kind of that summarized data, because we have an Indian Health Clinic where there may have been a reoccurrence of some, everyone might have diarrhea at a certain point in time, just for example, and we don't know that, and we don't know, that information isn't really readily available. It's one of those ones that's really hard to get at. So.
Yeah, no, you're trying to coordinate, let me make sure I understand. So you're trying to coordinate the epidemiology, like the illnesses, with the drinking water. Okay, perfect. Thank you.
CDC does have a webpage that's reporting, but I don't know whether they're participating in those reporting in the NORS system or not is a different question. Were you talking about getting more outreach so that practitioners understand how to report those things?
No, it's more of the assessments, like when we are doing the assessments and evaluating the vulnerability of a system, is that there's another aspect into that, and that's the public health, and that's I don't know. And as a concerned person as well, how do you report what's going on with you and possibly correlate it to maybe some drinking water issue or problems?
You're saying it as an indicator, I think.
As an indicator,
As an
yes.
indicator of drinking water issues using the epidemiological health.
It's really underreported, I can tell you that. If you go and look at the
Right.
CDC website, it's really underreported.
And I do remember, and I should know who it was. It might be Irvine. I mean, there was somebody that was looking at increases in bottled water and increases in medicine purchases and hospitalizations and things like that. And
Maura Allaire.
is it Maura Allaire? Okay, thank you. I thought it was Irvine, but I wasn't sure.
And it goes back to this is the biggest thing ever since I got into water is like, I drink the tap, but people don't like to drink the tap because there's just this unknown, even though they get the confidence reports and all. And so they're encouraged to buy bottled water. They're encouraged to drink bottled water. And then we have landfills full of plastic bottles. We have areas full of plastic bottles. So they're concerned about their health, so they go and buy the plastic bottled water, So I think this wish list, I think that's something that I would really like to know.
Okay, thank you. No, I think that's a really important point. All right, anybody else need a Christmas belated holiday gift? No? Okay, well then I think we should wrap it up. And thank you all for staying till 4 on a Friday, or 4-ish on a Friday. Thank all of our panelists for coming. Thank you. I appreciate it. Okay, thanks so much for your input.
It happened.
Are you going to be here next week?
Yes,
I'll see you next week.
Yes, we'll have to catch up.